is the most common congenital disorder larynx. That's why it is important. What is the congenital defect in this child? Or what is the main complaint? Stridor is the only complaint. So stridor in infants is always laryngomalacia. What is stridor? Stridor can be defined as noisy breathing. So when the child is breathing in and out, there is noise in the breathing. And this is more severe in supine position. That means if the child is making lie down in the prone position, it diseases. And the second point is that it is inspiratory stridor. That means what is inspiration? When the child is breathing in, only then there is a stridor. When the child is breathing out, there is no stridor. It's called inspiratory stridor. And now comes the most important question. What is the laryngoscopy finding in this child? It is defined as omega-shaped epiglottis. This is a very, very important institute. Omega-shaped epiglottis is the only important question that they ask you from this disease. And omega-shaped image is also important. How do you write omega? As in omega. Epiglottis becomes like this. Like this, like omega. Omega. Actually, omega is written like W also. There are two ways of writing omega. This is omega, this is omega. So those who know. So this is the correct one. Treatment. What is the treatment? Nothing. You don't have to do anything. Wait for a few months. अपने आप ठीक हो जाएगा. So this is called reassurance. You just have to give assurance to the parent of the child that nothing is to be done till you on its own. So that's called reassurance. There is one more name that you remember in congenital, and this is about subglottic stenosis. Stenosis of the subglottic area. This is also a congenital disease. This is not only congenital, it can happen to other conditions, but congenital is one of the causes. You don't have to remember that line in canalization, incomplete canalization and all that is not important. So just ignore that. What is important is this name. It is a grading, and this name is an MC. Let's look at this name, Myron Cotton grading, and the last page is used for grading of this disease. It is used for grading of subglottic stenosis, and there are 4 grades which you don't have to know. So we're not going to talk about the grades and all that. So this is the only congenital disease. These 2 are the only names that you need to know as far as congenital disease are concerned. And the next topic is a very special topic, which is one of the most difficult topics of larynx. That it is very easy for you. Very easy actually, because I am teaching. Right. इस लड़की ने बोला क्या नाम तुम्हारा? क्रांति. देखो मैंने कल ये कलर यूज किया था क्या ये वाला? कल परसों नहीं किया था, आज किया. So क्यों? उसका टॉप देखो. थोड़ा तो समझ गया? Actually, I did not use this color yesterday and it was this one. Whatever color is that? Double this one? Magenta. Magenta A? Magenta A? Huh? I think is that what you are wearing at the same time. चलो जो भी है. Okay. Local word palsy. You can answer this very easily because you know the anatomy that we discussed. Which nerve, which muscles, and if something is wrong. If you remember that, then this becomes a very easy job. Now, causes. The most common cause is a controversy. There are two correct answers. One says thyroidectomy, and the other says idiopathic. Both are correct answers. But if we select one of the two, then thyroidectomy is a better answer. In that order. And there is a syndrome called Orphan syndrome, which is also going to cause palsy. Orphan syndrome has two features. One is vocal cord palsy, which is the other one. Cardiomegaly. Cardiomegaly. Now, whenever we have vocal cord palsy, it is usually due to trauma of these nerves that we have done already. So, which nerve will get damaged? It is possible to have this nerve damage. It is possible to have this nerve damage. It is possible to have this nerve, which is same as this nerve damage. It is possible to have this one. It is possible to have this one. So you can have vagus palsy. You can have recurrent laryngeal palsy. You can have superior laryngeal palsy. You can have external laryngeal palsy. You can have internal laryngeal palsy. Isn't it? All of them lead to vocal cord palsy. And each of them will give different features that we know already from this chart. Now, when we use the word palsy or paralysis, what do we mean? Palsy, paralysis, what do we mean? It means that the muscles stop functioning. Palsy because the body cannot move. And body will not move because the muscle is not functioning. Can internal nerve damage cause palsy of the vocal cord? The answer is no, because it's not supplying any muscle. It's just purely sensing it. And therefore, in vocal cord paralysis, this cannot be included. Because it's not a palsy as such. Is that clear? It's logical. So now, what are the palsies possible? You can have palsy of the recurrent laryngeal nerve, palsy of the vagus, palsy of the superior nerve, palsy of the external nerve. 4. Is that clear? So we have faces like recurrent laryngeal nerve palsy, which is also called abductor palsy. Then the second situation is vagus palsy, which is also called adductor palsy. Then we have external laryngeal nerve palsy, which has no other name, and superior laryngeal nerve palsy, which again has no other name. So these are the 4 types of paralysis of the vocal cord which are possible. Internal cannot be a palsy, so we exclude that. Now these two, both are divided into unilateral and bilateral. This is also unilateral and bilateral. This one is no unilateral, no division as such. Right. Now, out of these types of palsy, so we have four, six. 1, 2, 3, 4, 5, 6. 6 options we have, possibilities basically. And it sounds pretty logical if you remember that matter that we discussed. Now, out of these 6 types of palsy, the first 4 are very important. These 4. They're very, very important. So we first about these 4. And these 2 which are less important, afterwards we cover this also. So we cover all of them. First the main one, then the less important ones. So we have 4 columns like this. I'll make 4 columns. Unilateral recurrent laryngeal nerve palsy. Bilateral recurrent laryngeal nerve palsy, which is this one, abductor palsy. So I'll write here abductor palsy on both sides. Unilateral vagus palsy, which is adductor palsy of one side, and bilateral vagus palsy or bilateral adductor palsy. Like I said, first these 4 and then those 2 also. This is more important. This slide is going to be a very important slide for you. Now, for each of them, only 3 points. A, what is the position of the vocal cord in each of them? Position of the vocal cord is 1 point for each of them. Second, the main complaint. We are only going to cover the main complaint, the other complaints also, but only the main one. And third, what are the surgeries that we can do for each of them? Nowadays, surgeries are very, very common. Surgery is going to be very, very important. So 3 points: position, feature or main feature, and surgery. Now, before that, you must have seen that whenever you draw the diagram of a vocal cord, you always draw it like this. Which is like this. We never do the vocal cord together, abduction, and we never do the vocal cord like this, abduction. Neither this, we always draw like this. Like the one I've drawn. Why? Why do you think we do this? Because this is a neutral position of the vocal cord. Neutral position. Neutral means it is not doing anything now. No, in this position, vocal cord cannot do anything. You can't speak, you can't whisper, you can't breathe properly, nothing. It's a neutral or resting position. Vocal cord is resting now. Right? And no muscles are acting, no nerves are acting, no energy is being used. That's why in a dead body, when all the forces are gone, there is no muscles functioning, the vocal cord comes in the same position. In a dead body, the vocal cord is in this position. Neutral position. Everything is neutral in dead body. So neutral position. What is dead body also called? Cadaveric. This is also called cadaveric position. This is a cadaveric position. Or you can call it a neutral or a resting position also. But like I said, in this position, vocal cord cannot do anything. If you want to speak, the vocal cord has to come in the midline. You know, both will have to come in the center and meet. So this vocal cord will have to come in the midline, in the center, for speech. This is called median position. So median position is important for voice production. And sometimes come between the two. Here, between the two, this is called paramedian. And paramedian is usually used when you whisper. That is improper voice. Whisper is not complete voice, so half medialization, half voice. You can remember that. Parameter. And when you want to breathe properly, it goes out here. This is for proper breathing, and this is abducted position. So these are the four positions possible in a vocal cord: median, paramedian, cadaveric, abducted. The position is going to take depends on what you want to do. If you are speaking, it is median. If you are whistling, paramedian. If you are breathing properly, it is abducted. And it keeps shifting from one to another position. And that's why your vocal cord is always mobile. It's always moving, all the time. But we are dealing with vocal cord paralysis, where the vocal cord is not supposed to move. Paralysis, isn't it? So depending on the type of paralysis that we discussed, it will come to any one of the four positions. Depending on the paralysis, it will come to one of the positions. And once it attains a particular position, it cannot move from there anymore. That's why it is paralysis. So that's why the first question is, what is the position of the vocal cord in each of these conditions? In the first case, vocal cord, these two, because it is same paralysis, it is both abductor paralysis. In one case it is on one side, in the other case it is both sides, but the position is the same. What is the better answer? Paramedian. The answer is paramedian position is the correct answer in abductor paralysis. But if this is not given, you can use median as a correct answer also. So this is also possible. Paramedian is a better answer, median is accepted. You understand that in unilateral paralysis, it will happen on one side. In bilateral paralysis, this will happen on both the sides. So that's the only difference. Same is the case with these two, because they are in same paralysis. The better answer is cadaveric position, and it can also cause abducted position. So this is the first important. What is the position on in each of them? Next, the main complaint in each of them. In the first one, hoarseness of voice is the main complaint. But this hoarseness becomes normal on its own. Ultimately, there is no problem. अपने आप ठीक हो जाएगा. But they ask you the complaint of the second one. Bilateral abductus is a very important MCQ. What is the main complaint? And the answer is good voice, but dyspnea, difficulty in breathing. Voice is good, breathing is problem. Which is more important, voice or breathing? Breathing is more important. So this is a dangerous condition because of difficulty in breathing. Third is hoarseness. But this will not become normal like the first one. It becomes normal, this doesn't become normal. And the last situation is aphonia. What is aphonia? No voice plus aspiration. You know what is aspiration? And aspiration is life-threatening. Am I right? So this is also dangerous. This is life is in danger because of aspiration. And there is no voice at all. Aphonia means absence of voice altogether. So these are the position of the vocal cord in each of these situations. And the last thing we have to do, as I said, is the surgery that is required. What surgery for which one? In the first one, I will not do anything because the voice will become normal. So why will I do anything? It's illogical. In the second one, I don't have to do anything for the voice because the voice is already good. But if I don't treat the dyspnea, the patient's life is in danger. So I have to do something for the dyspnea. And there are 3 or 4 surgeries that are possible. And this is the most important. In this chart, now we have to do the most important thing, the surgical options for dyspnea in bilateral abductor palsy. Option number 1, type 2 thyroplasty. It is also called lateralization of vocal cord. It is also called lateralization of vocal cord. Then there is a surgery which is very important called Kashima's operation. This was asked 3 years back in your exam. And the question they asked is, Kashima's operation is used for which are the following diseases, conditions. They give you all these 4 choices. And they ask you Kashima's is for, the answer is bilateral abductor palsy. Third surgery, Woodman's operation. And the fourth one is chordoplasty. Remember this very important points. So the 4 names, all the surgical options for bilateral abductor palsy. The aim is to improve the breathing dyspnea. Then let's start with the third situation, where there is hoarseness, voice is not good. And to improve the voice of this patient, we have 2 surgical options. We do type 1 thyroplasty, opposite of the previous one. In type 1, I can do opposite, so it is medialization. Of vocal cord. So this is one option. And the second option is injections. Injections either Teflon or collagen can be used. So once again, we have 2 options. You can inject Teflon or you can do type 1 thyroplasty, which is medialization. And then we talk about the last option, which is aphonia and aspiration. Now, aphonia cannot be treated. You can't do. The patient has to live with this. But if you don't treat aspiration, then so you have to do something, isn't it? And the aspiration will be option as surgery, total laryngectomy. Plus permanent tracheostomy. Total laryngectomy with permanent tracheostomy is the only option you have for aspiration, if it is life-threatening. Otherwise, we don't do it. From the name you understand, you have to remove the entire larynx. So you can't remove the larynx just for simple reasons. You will only remove the larynx अगर लगेगी तो जान को करना है. Life is in danger. Otherwise, you don't remove. Okay, so position, main complaint, and surgery very important. So this slide is very important. And then we talk about those 2 situations. Which one? External laryngeal nerve palsy and superior laryngeal nerve. You know already. What is the problem of external laryngeal palsy? You know there is loose vocal cord. Loose vocal cord, the tension is gone, and therefore there is low pitch voice. Low pitch voice. And there's one more thing here, just remember there is a position called aspirate position. In external angioplasty, these are the three things that you will get. And finally, what is the problem with superior laryngoplasty? See, external is a branch of superior, am I right? So all this will happen, same. In external, all this will happen plus something, plus aspiration. That means superior laryngoplasty, there will be low pitch voice, there will be low vocal cord, aspirate position, and aspiration also. And these are the different types of vocal cord paralysis that you have to know. The first four that we discussed was very important. These two also try to remember. Once in a while, they ask this. Well, this is they can ask. And we discussed two thyroplasty also mentioned. What was the thyroplasty we mentioned? Type 1, type 2. Type 1 में क्या करते हैं? Legalization. For osmosis, unilateral adductor. Type 2, legalization for dyspnea in bilateral adductor. Thyroplasty can be type 3 and type 4 also. So these are the four types of thyroplasty that we have to know. Type 1, type 2, type. What is done in each of them? What is the main indication? This is important. They ask you thyroplasty, so it is important. The first two we know, the next two you have to remember. That's it. So as you can see, type 1 is medialization, then for unilateral adductor palsy. Type 2 is lateralization, then for bilateral adductor palsy. Type 3 is either shortening or loosening. And type 4 ulta, tightening or lengthening. Type 3 is done for pneumonia. Type 4 is done for androphonia. What is pneumonia? Pneumonia is adult male having female live voice. Adult male with female live voice. And androphonia is opposite. Androphonia is female having male live voice. And we come across some people once in a while, even in the society. You come across, usually it is very common to have a male like a female like voice. It's very common. जब भी मैं ये पढ़ाता हूँ मेरे को सचिन तेंदुलकर की याद आती है. I don't know why. I laugh. ऐसा बात करता है ना? अब तो इम्प्रूव हो गया लेकिन उसका वोकल कॉर्ड की लेंथ थोड़ी बीच में है. मेल और फीमेल के. मेल की लेंथ कितनी है वोकल कॉर्ड? 24-25. फीमेल की सचिन के बीच में थी. ना मेल जैसी वॉइस है ना फीमेल जैसी, तो बीच में है इसके. कहते हैं हर किसी को मुकम्मल जहां नहीं मिलता. सचिन को सब कुछ मिला, वोकल कॉर्ड की लेंथ कितनी है? बेचारा बाइक की ऐड नहीं कर सकता. ये धोनी को देखा है बाइक पे बैठता तो लगता है कि धोनी को ही बैठा हुआ बाइक है ना. तो मैं इमेजिन सचिन में बाइक चलाओ. नवी में तो स्कूटी चला. Why is it girls are all the fun? स्कूटी चलाता है बेटा. But he is a fabulous guy, है ना. Naveen is a good cricketer, but he's also a nice guy. I think so. लगता तो ऐसे ही. फालतू की कंट्रोवर्सी कभी नहीं बढ़ा, है ना. जैसे ये हमारा टोली है तो चलता फिरता रहता है, देख के करेक्ट ढिला रहता है उसका. Let's say actress to that is earning a lot. That's the bottom line. क्रिकेट में कितना पैसे कैसे कमा सकते हैं? जो आप लोग डॉक्टर बनोगे, सर्जरी करोगे, कितना पैसे लोगों की जान बचाओगे, पढ़ाओगे नहीं, पढ़ाने के लिए तो बहुत करना पड़ता है। पढ़ाओगे नहीं लेकिन फिर सोचो वो आगे क्रिकेट में 2 दिन तो किसको मारेगा? सचिन तेंदुलकर कितनी सेंचुरी मारी है? 100 है ना, सबको पता है। कितनी बार सिंगल डिजिट में आया पता है आपको? सिंगल डिजिट में कितनी बार आउट हुआ? 0 till 9 मोर देन 50 टाइम्स। तो उसके देखो 50 बार वो सिंगल डिजिट मतलब कोई 0 के बराबर, वो किसी को नहीं पता। आप अगर 50 सर्जरी आपकी गड़बड़ हो गई ना लाइफ में, 50 में 5 भी सर्जरी आपकी गड़बड़ हो गई तो यू आर गॉन। आपको कोई पेशेंट नहीं आएगा। आपकी 2-3 सर्जरी भी गड़बड़ हो गई तो फिनिश, यू आर गॉन। पूरी सोसाइटी में आप बदनाम, वो बेकार डॉक्टर है, इसके बाद में वहां जाना मतलब मरना है। बट फॉर मी सिंगल डिजिट इन क्रिकेट इज ऑलमोस्ट लाइक अ फेल्ड सर्जरी इक्विवेलेंट टू दैट। कैसे बोलो? शहर से ये रेपुटेशन आपके साथ जाती है बेटा। आजकल तो सोशल मीडिया का जमाना है। पीपल चेक, आजकल तो रिव्यू चेक करते हैं हर चीज का, डॉक्टर का भी रिव्यू चेक होता है। ये सोच लेना कि शहर चेंज कर लोगे रेपुटेशन चेंज नहीं कर सकते। तो बिकम अ क्रिकेटर बेसिकली द moral of the story is क्रिकेट खेलना शुरू कर दो। ओके, नेक्स्ट टॉपिक। नेक्स्ट टॉपिक इज laryngitis, inflammation of the larynx। ये तो पुराने जमाने में गाना था कोई, इसका था, ये उसे बजाना, उसका फोन करना है। So we have 2 in the acute and 1 in the chronic. Acute is epiglottitis in croup. What is croup also called? Croup is also called laryngotracheobronchitis, isn't it? मतलब larynx, trachea and bronchus all the 3 at the same time. Now for epiglottitis and croup, you have to know 5 points about epiglottitis and 5 points about croup. And all these points are very opposite of each other, very different. So what do I do? I compare them. I make 2 columns. यही है, यही तो है। और ट्यूबरकुलोसिस बता दो। ट्यूबरकुलोसिस, हे भगवान, बहुत मुश्किल होने वाली जिंदगी, सीरियसली आएगा, दूसरा दिन आएगा। Done? Yes, sir. Now, like I said, both of them, you have to know 5 points each, and they are very opposite of each other. So easy to remember. Comparison is better. So, like pathogen, which is the pathogen epiglottitis? In India, Haemophilus influenza is the most common pathogen. In India, but Streptococcus worldwide. So now you have to be very careful about the question. Suppose they tell you a 5-year-old child from Delhi has epiglottitis, something like epiglottitis. Now 5-year-old child from Delhi, so it is India. So the answer is, if they ask which is the pathogen, that is influenza. But if they do not mention the country, then we are assuming it is worldwide. Then you have to say Streptococcus. But laryngotracheobronchitis is a viral disease caused by Para-influenza virus. Yes. Age. This is 2 to 7 years old. On an average, the age is 5 years. And this is less than 3 years old. Main complaint: fever, dyspnea, and dysphagia. What is dysphagia? Difficulty swallowing. Two are same here. Fever and dyspnea are same, but no dysphagia. There is voice change instead. Fever, dyspnea, and voice change. And now comes the most important MCQ, the X-ray finding. And most of you know the answer. What is the X-ray finding for epiglottitis? It is called thumb sign. This is very, very, very important. Thumb sign. And can you see the epiglottis, the arrow? This epiglottis here is a shape of thumb. The thumb sign. And what is the X-ray of crew? This is the X-ray of the crew, and this is described as steeple sign. ये आपके एग्जाम में 2 साल पहले आया था. 2 years back they had asked this question. Steeple sign is a picture of which disease. When you see it is explained in the diagram, it is like this. You know, when you see this airway, this is steeple. This is pencil tip भी बोलते हैं, pencil sign. Pencil is shaped like this. Pencil tip sign भी बोलते हैं. Steeple pencil sign. So very important to identify these two X-rays. This is steeple sign. This is thumb sign. This is epiglottitis. The other one was crew. And the last thing is the treatment. See, epiglottitis is a bacterial disease, and therefore you have to give antibiotics like cephalosporins. This is a drug of choice. But if the patient comes in emergency with severe distress, then the first thing that we do is we give steroids. If the steroid is not useful, we do tracheostomy. Steroid is the first thing in emergency that we do. And we can also do immunization or vaccination, because vaccines against influenza is available. So vaccination is also possible to avoid or prevent the diseases. In proof, we do 3 things to every child. We always give steroid. And we do nebulization with epinephrine or adrenaline. You can say adrenaline, chalega. And although it's a viral disease, we still give antibiotics to prevent supra-added bacterial infection. So these 3, all of them are done in a patient of croup, that is what bronchitis. So 5 points each. If you compare them, it becomes easier to remember, and it also saves time studying and learning. Both these images, this one as well as this one, are very important. And chronic laryngitis, tuberculosis. The first question is, which is the most common site? It is here. This is a tuberculosis. So what site is this? Posterior glottis You can say inter-arytenoid area. Between the two arytenoids. Inter-arytenoid. Posterior part of the larynx, posterior glottis, inter-arytenoid, all are same thing. Steeple sign is in croup. Yes, steeple sign is a feature of croup. Presentation. Hoarseness is the main complaint. Anything in the larynx, hoarseness तो होता ही है. Plus throat pain. Like anything in the ear, hearing loss होता ही है. Now this is the what they ask. There are 3 findings, which I'll tell you. And this is the most important thing in tuberculosis. There are 3 findings. So we have 3 findings: top and epiglottis, mouse nibbled appearance, and cobblestone. In tuberculosis, these 3 names are the most important MCQs. Very important. Very common. Laryngitis. Demand. Online demand. Area. Inter-arytenoid area. Nibble क्या था? Nibble? Nibbling? कुरेदना. In Hindi is called कुरेदना. The nibble it. Done? ट्रीटमेंट बताने की जरूरत है क्या? Anti-tubercular therapy. The full course of anti-tubercular therapy के drugs वगैरह बहुत important. Pharmacology, you can know everything about this. The slow drug treatment and then MDR में कौन सा ऐड करते हैं food drug, all that is very important. And now we come to a very important topic of the larynx, the growths. Growths of larynx. This can be divided into non-neoplastic growth and neoplastic growth. Under the heading of non-neoplastic growth, we have 5 benign growths. As you can see, we have in the first list we have vocal cord nodule, vocal cord polyp, ring piece edema, laryngocele incubation granuloma. These are all non-neoplastic. Neoplastic can be benign or malignant. Benign is papilloma, and malignant has to be a carcinoma. There are 7 conditions, and we'll talk about all of them. In all these growths of the larynx, one common question which is very important for each of them, the most important question for each of them, which you have to know, is the treatment of choice. सबका treatment बिल्कुल अच्छे से याद रखना चाहिए properly. We'll start with the nodule and polyp. What is nodule also called? It is called singer's nodule. Because it is in singers. Now, nodule and polyp, we have to know 6 points about each of them. 6 points about nodule, 6 points about polyp. And out of the 6 points about nodule and 6 about polyp, 3 are same, common, and 3 are differences. And therefore, once again, I make column to compare them because it's easy. Vocal cord nodule versus vocal cord polyp. 6 points about nodule, 6 points about polyp. Common points, the cause is same. What is the cause? Chronic misuse of voice. Plus minus smoking. If somebody has to use the voice too much, that's called chronic misuse of voice. And if the patient is also a smoker, then the chances become that much higher. So this is common to both. And the site is the same. What is the site? It is seen at the junction of anterior 1/3 and posterior 2/3 of vocal cord. Which means, if I draw the vocal cord like this and divide into 3 equal parts like this, 3 equal parts, then nodule is seen here and here, and polyp is seen here. You see, site is same. Junction of anterior 1/3 and posterior 2/3 of the vocal cord. Very important this. And the third common point is the main presentation is the same. Hoarseness of voice. Plus minus diplophonia. Double voice. Diplophonia is double voice. And 3 differences. Nodule, as I've drawn here, is bilateral. Can you see both sides? Polyp is unilateral, that's why I've drawn one side only. Nodule is less than 3 millimeters, very small, that I've drawn small, and this is more than 5 millimeters big, and that's why I've drawn big polyp. So these two are very simple. But the main difference is the difference in the treatment of choice. What is the treatment of choice for nodule? Voice rest, which is the first line of treatment. If this fails, it will do surgery. What surgery? Microlaryngeal surgery. Microlaryngeal surgery is called MLS in short. microlaryngeal surgery, MLS. But that's the second line of treatment. Surgery is not done initially. And from the name you understand, you have to use microscope to do this surgery. In polyp, the treatment of choice is MLS. You have to do MLS every patient plus voice rest. Voice rest is an additional option. But the main thing is the surgery, microlaryngeal surgery. So very important, nodule in polyp, 6 points each. Not very difficult. This is nodule. Both are nodule. You will see there at the junction of anterior 1/3 posterior 2/3. Very tiny little thing, and at the junction of anterior 1/3 posterior 2/3 nodule. Compare this with polyp, which I'll show next. This is polyp. We can make out they are both on one side only, much bigger than the nodule, but the size is the same, anterior 1/3 and posterior 2/3 junction. So when you see the image, nodule and polyp, I think it is easy to identify. Rinke's edema. Edema of Rinke's space. याद है Rinke's space? ना? कहाँ? What is near below the vocal cord? Below the vocal cord. These are the causes. The causes of Rinke's edema are talkative smoker female. That's what we are. Smoking and talkative females. Females who talk a lot and smoke at the same time. They tend to have Rinke's edema. And hypothyroidism can also cause Rinke's edema. Hypothyroidism, I'm sure you know, can cause any edema. So can cause Rinke's edema also. Hypothyroidism. This is how it looks like. You can make out the vocal cord, they are full with water. You know, the edema is full of water like a balloon. They look like a balloon. Hoarseness is the only company. Or you can call it voice change. Voice change. It's easily diagnosed. Laryngoscopy you can do and you can see this Rinke's edema. इसका नाम क्या है? तो लड़का blue shirt, हाँ नाम कल पूछा था ना सर, हाँ गुरुदत्त and वो लड़की गुरुदत्तनी क्या नाम बताया? सोनम. मैं 3 दिन से देखा, मैं बोला नहीं क्योंकि मुझे लगा कि बात कही तो कोई 3 दिन में कभी तो खत्म होगा और फिर बात खत्म नहीं. अरे मेरे 25 साल हो गए पढ़ाते हुए और ये मैं 25 साल पहले कर चुका हूँ ये पढ़ाई वाली डिस्कशन क्लास के अंदर. वैसे भी मैंने बताया क्लास में कुछ भी ENT से रिलेटेड डिस्कशन करना तो मेरे साथ करो. I am the right person. I'll tell you all the right things. Always. I always think कि जो बात आपको समझ में नहीं आई, हो सकता है कि वो बात आपको फ्रेंड को भी नहीं समझ में आई. आपके साथ में बैठा हुआ और उससे आप पूछोगे कि क्या चाहिए, वो अपनी इज्जत के लिए बोले तो कुछ भी बताएगा. होगा कि बताओ नहीं पड़ेगा क्योंकि इज्जत का सवाल है कि मेरे को समझ में नहीं आया तो गलत भी हो सकता है. इसलिए always ask me. I am always there. अब ये नहीं होगा बार बार. कौन सी वाली? ये वाली, ये वाली. So what is the treatment? Is diagnosis usually I said treatment conservative. Nothing doing. Just ask the patient to stop smoking and stop speaking for some time. That's the meaning of conservative. Stop smoking and stop speaking for some time. And of course, thyroid you have to supplement thyroid and all that. When we say conservative, it means no surgery, basically. But if it fails, then of course surgery has to be done. And the surgeries are two. You can do what is called reduction glottoplasty, which is a better answer. You can do stripping of vocal cord. Stripping. Okay. If you read your books, they will say the surgery of choice is this, which is the wrong answer. For you, the surgery of choice is this. The Purana answer. Now it has changed. This is not the correct answer. If this is given, then this is the correct answer. But it is not given, of course, it's the stripping of the vocal cord. But look for reduction glottoplasty. This is a recent new better answer for Winky's edema. Next, laryngoscele. We draw the larynx like this. Yeah. What is this? Saccule. This is saccule. Am I right? Sometimes what happens, due to excess collection of air and fluid, these saccules balloon. Laryngoscele. I'll come to this. First, write this definition. Definition over. So first, write the definition. I'll show you that image. Yes, I said larynx में कुछ भी होगा, hoarseness is always or almost always there. So everyone, hoarseness is the main complaint. Voice change is the main complaint. Anything in the larynx. Additionally, there could be dyspnea or aspiration. But voice change is always there as a main complaint. So it's a ballooning or dilation of the saccule due to collection of air or fluid or both. Which can be shown like this. And this is mainly seen in what is called trumpet blows. Those who have to play that instrument, trumpet, with a lot of force. Have you seen that marriage party में जो हो रहा है, शादी में जो खड़ा होता है सबसे सामने बड़े वाला? Have you seen that? You see that guy? Next time you go to that marriage person, look at that guy's cheek and eyes as if निकलने वाला, आँख निकल के बाहर का force लगा रहा है. आँख तो नहीं निकलते, कुछ और निकलता है उसको. बाहर निकलती है. So much of force. So imagine how much is the pressure in the larynx in that guy. And you know, वो 2-3 घंटे तक चलता है वो सब. आप मस्ती से डांस कर रहे हो, आपने चढ़ा लिया, आप डांस करे जा रहे हो, शादी में दूल्हा हो, गधे के ऊपर गधा बैठा हुआ है और 25-50 का नोट आपने मुंह दबा के डांस करे नागिन, तो 50 रुपए के चक्कर में वो चलता रहता है और वो 50 रुपए कौन ले जाता है? उसके बीच में वो शेरवानी पहन के पत्नी वाले तो बंदा उससे शुरू करता है. अदर बीच में उनका लीडर होते हैं, शेरवानी पहन के हमेशा इस पत्नी वाले होते से बाद बस एक लाइन बोलता है, वो शुरू है फिर वो घर जाने फिर करता फिर और सारे कैसे बोलेगा तो ये किसको फिर उसको सर्जरी करवानी है ये वाली, ऐसा उसको नहीं है, फिर उसको सर्जरी करवानी है, तो मैं उसको क्या दूंगा इसको, या फिर अपना कार्ड भी देता हूँ डॉक्टर संजय अग्रवाल ENT सर्जरी आ जाना जरूरत पड़े तो, वो पैसे मेरे को पता मेरे पास आने घूमते, आई डोंट माइंड गिविंग दैम 1000 रुपीज, तो 1000 के चक्कर में 10,000 आएंगे, बिजनेस मार्केटिंग। So next time you go to that marriage party and dance करो तो इस वक्त लोग जरूर पैसे देते हैं, मेरा कार्ड भी देते हैं, नाम देते हैं। But the point is, the serious point, you understand what I mean by trumpet blowers? The people who play this instrument like saxophone, this marriage party, this in the army जो कर जाते हैं, trumpet blowers, these are the ones, and glass blowers. Glass blowers आपने देखा ना, glass जो बनाते हैं, they have to the pipes से वो, these are the kind of people who tend to have this because they have to apply lot of pressure. And where is this happening? What layer is this? Mucosal layer. It's happening in the mucosal layer, which is inside the larynx. And we all know that this mucosal layer is supported by the cartilages. So if you look at this diagram, that if this larynx remains within the cartilage inside, it is called internal, INT, internal, and it comes out of the cartilage too big, it is called external larynx. The larynx can be internal or external, depending on whether it is within inside the cartilage or outside the cartilage. As you can see in this two diagrams, you can make out easily. Complaint is the same. What is the complaint? A trumpet blower with hoarseness of voice, plus minus neck swelling. Who will have neck swelling? The one who is external. The one with internal cannot have a neck swelling. So a trumpet blower with hoarseness and neck swelling is a laryngoscele patient. This is how it looks like. Look at the first image. If this person is a trumpet blower, without any doubt, this is a laryngoscele. And this is the X-ray showing laryngoscele. This is CT scan showing laryngoscele. This is the laryngoscele. And this is the laryngoscele. And treatment is surgical excision and repair. What is the treatment? You do the surgery, remove the extra tissue, and the remaining has to be repaired. Surgical excision and repair. And the last non-neoplastic growth is intubation granuloma. Is also called contact ulcer. Intubation granuloma and contact ulcer, same thing. What is the cause? Intubation. The cause is intubation. Unless you have surgery, intubation. When do you intubate? Either during surgery or the patient is coma, ICU, so one of the two is definitely there. Either the patient has undergone some surgery or he was admitted in ICU for some problem, stroke and all. Site. Look at the diagram and tell me site. Arytenoid cartilage. This is arytenoid cartilage, which is in the posterior part of the larynx. Both are correct. If it is arytenoid, it is okay. If it is a posterior part of the larynx, it is okay. But there is a better answer. Where is nodule and polypsine? Junction of anterior 1/3 and posterior 2/3. Ye ulta hai. So this is seen at the junction of anterior 2/3 and posterior 1/3. Junction of anterior 2/3 and posterior 1/3. treatment. In the treatment of intubation granuloma, you have to do 4 things. You have to do CO2 laser excision, plus you have to give steroids, plus mitomycin C, plus Botox. All have to be done together. Charo exam. So too many things to do, that's why it's an important question, the treatment. So you have to do many things. You have to do surgery with CO2, you have to give steroids, you have to give mitomycin C, you have to give Botox. And there's something plus also. You know what is that last plus? Pray. Pray to God. Because ये चार के बाद भी ठीक नहीं होता. You know what it means is, even after doing all these things, you cannot be sure. So sometimes the prayer is going to work. So it's difficult. What it means is, it's difficult to treat intubation granuloma despite so many things. Now, something which is difficult to treat is best avoided. Prevention is better than cure. So something which you cannot treat, you should avoid. And that's why when you intubate, you have to be careful. During intubation, you have to be careful. वो पीछे वो लड़का बहुत खुश है, ब्लैक टी शर्ट वाला. Okay. So this is intubation granuloma, and this will complete all the non-neoplastic growths. We'll talk about neoplastic growth, which is divided into benign and malignant. What is the benign growth? Papilloma of larynx. These are the other names for papilloma of larynx. It's either called multiple papilloma of larynx, or it's called juvenile onset recurrent respiratory papillomatosis, JORRP. Called by HPV1 and HPV6 and HPV11, human papillomavirus 6 and human papillomavirus 11. So what are the points you know from the name? The name tells me they are multiple in number. Yes or no? They are seen in juvenile age and they are recurrent by nature. So 3 things you know from the name: that they are multiple in number, they are seen in juvenile age group, and they are recurrent by nature. Why do you think they are recurrent by nature? Because they are caused by virus. And treating virus is very difficult. So this virus is the most important question from here. Very, very important. Which virus? 6 and 11. The stage is important. Most people remember the HPV, but 6 and 11 will get confused. So presentation is a juvenile child, juvenile with hoarseness. Again hoarseness. A juvenile child with hoarseness. You know what papilloma looks like. Papillomatous growth, you know what it is. This is how a papilloma looks like. So you can see it is multiple, both sides, group, and there is no particular site. It can involve the entire larynx. So once again, if you know how it looks, it is easy to diagnose. Treatment. This is the treatment. First line. You have to do multiple excision because there is multiple papilloma, and you have to give antiviral because it is a viral disease. So multiple excision is done with microdebridement, or you can also do CO2 laser excision. Microdebridement or CO2 laser excision can be done. And to treat the virus, either you give intralesional acyclovir plus steroids, plus interferon. This is local antiviral. This is systemic antiviral. You can say that. Local plus systemic is used. So this term intralesional acyclovir is a very important term. What is the meaning of intralesional? Inside the tumor, inside the lesion. So once again, the treatment is important. Everything is important. Now, if you read your books, most of them tell you that treatment of the surgery of choice is this. Not anymore. This was, but now the surgery of choice is microdebridement. Is a better option. So remember that. What is the first image? First image. Vocal cord nodule. Second image. Polyp. Third image. Ventage edema. Fourth image. Intubation granuloma. नीचे वाला first image. Papilloma. Second image. Laryngoscopy. Try to compare and remember them because they are all image-based questions. So if you have one, you can compare and remember them easily. Along with confusion, and together, it is easy to remember them and differentiate between them. And asana, very easy. But they will never give you only image; they will always give you a history. So history will help you in knowing. And the last group is laryngeal carcinoma. Laryngeal carcinoma, the only important thing is the treatment. But few things like which is the most common site? Glottis. We all know it is more common in males who are more than 55 years old. Males who are more than 55 years old tend to have this. And we all know the causes. Mainly, smoking is number one cause. Plus alcohol is number two cause. And any other? Any other? Asbestosis. Smoking, alcohol, mainly, but asbestosis can also cause laryngeal carcinoma. Presentation. बताइए आप. Hoarseness. Let me tell you, laryngeal carcinoma is not caused by any virus. Human papillomavirus of any strain is not cause of laryngeal carcinoma. It used to be believed in the past, around 10-15 years back. If you read old books, they say it is caused by HPV 16 and 18. But then after that, future research, they conclusively proved that HPV has no role in laryngeal carcinoma. No role. So it does not. Viruses do not cause laryngeal carcinoma. Please make a note of this. Maybe if you read old books, old question paper, it might be, but that is wrong. Not anymore. Hoarseness. Then dyspnea, difficulty in breathing. These are two most common complaints. Lymphadenopathy can happen. Lymphadenopathy. Dysphagia, which is difficulty in swallowing. Throat pain. Plus minus earring. So these are some of the presentation of laryngeal carcinoma. The first two are more important than any other. Hoarseness, anything in the larynx I can do hoarseness most of the time. Now once again earache. These are the larynx causing pain in the ear. The cause has to be the same. What? Referred pain, neuralgia, and once again the same question, which is the nerve? Which is the nerve? If I tell you laryngeal carcinoma causes ear, referred pain to the ear, which nerve is involved? What do you say? INC says, what's your name? Mahela. Mahela. Mahela says, Mahela तो एक cricketer था. Mahela. Okay. She says ninth nerve, loss of cranial nerve will cause the pain in the laryngeal carcinoma to the ear. True or false? So she has changed her answer. She is now saying it is Vegas. Vegas. What do you think? Is it better? Vegas is correct or ninth is correct or both are wrong? Larynx has only one nerve. We discussed this. The only nerve in the larynx is 10th nerve, vagus. And therefore, any pain from the larynx can only be carried by vagus. But do you have a branch of vagus in the ear? That's the ear में जाके ear में भी होना चाहिए vagus. Do you have a branch of vagus in the ear? R nerves. याद externally में 5 nerve थी A, greater lesser. The second A was R nerve. R nerve is a branch of vagus. Same nerve. So common nerve supply. R nerves in the ear and vagus in the branch of vagus and vagus here. Therefore, same thing. Adan Pradhan. Your ear problem, larynx can have a problem. If your larynx problem, ear can have a problem. That's why and we clean the ear like wax for our body. When you clean the ear, this nerve gets stimulated. Which one? Vagus. R nerves in vagus, and the larynx gets stimulated. If you stimulate the larynx, क्या होता है? Coughing, खांसी आती है. So this is always happen. If you clean your ear, then the person starts coughing. And this is because of vagus. They ask which nerve causes R nerve or vagus, both are same thing. That is the correct answer. Right? So investigation is laryngoscopy you do. Then you take biopsy for histopathological examination plus CT scan. This will give you the entire information that you want. Laryngoscopy in biopsy and histopathology and CT scan. CT scan will help you see the extension of the disease and make a staging, because the treatment depends on staging. And the only thing they ask you actually is a treatment based on staging. So what are the stages we have? Stage 1, stage 2, stage 3, stage 4A, 4B, 4C. 6. These two, same option. These two, same option. This is different from the first. So we have 3 different options. Now, once again, what I want to tell you, this is the most important question from the larynx. If you tell me, if you ask me, in last 10 years, पूरे throat में से pick one question which is most commonly asked in the exam. One question of larynx, throat, पूरा throat, nasopharynx, oropharynx, larynx. This is the most commonly asked, most frequently asked question. Carcinoma of larynx का treatment. So, And the second important point is the answers have changed recently. 3-4 years back, the answers changed. So if you read in your books, in your MCQ book or in some app and all, what is different from what I'm going to tell you, ignore that. What I'm going to tell you is your correct answer. So this is going to be your correct answer. These have all changed recently. Now in this tool, we have two options. If you read your books, there is a radiotherapy is the best option. It was. It is not anymore. So what is the better option? The better option is transoral laser microsurgery, TLM. In short, it's called TLM. So look for this term TLM. If this name is given, it is a better answer. If it is not given, then of course radiotherapy is accepted. Okay? Stage 3, 4 and 4B. Again, we have two options. Once again, the same problem. If you read your books, most of the books will tell you laryngectomy, which is surgery, followed by radiotherapy. But once again, this was the best answer. It is not anymore. So which is the better answer now? The better answer is concurrent chemoradiation. Chemotherapy and radiotherapy together. If they don't use the word concurrent, if they only write chemoradiation, then that is not correct. The word concurrent has to be there. And this is a better answer, not this. And what is the treatment for the last option? Only one option we have. Same, actually same, which is concurrent chemoradiation plus salvage surgery. The same as previous one, but we add something, a surgery called salvage surgery. So this is your best answers in the ideal task mark, depending on the stage that they ask. So we get confused because in all the books and MCQs and app, so you might say इसमें भी ये लिखा हुआ इसमें भी ये है लेकिन सर ने छोड़ बताया मैंने आपको सही बताया बोलो सैलवेज सर्जरी क्या सैलवेज का मतलब क्या होता है इज्जत को बचाने होता है सैलवेज सम प्राइड कुछ तो बचा लो यार इज्जत दे दो तो सैलवेज सर्जरी मतलब it is force is very big you can't remove सर्जरी कर सकते लेकिन बड़े ट्यूमर में रेडियोथेरेपी and chemotherapy is not effective. So we decrease the size so that it is not going to remove the tumor, but at least radiotherapy and chemotherapy is going to be effective on that. So that's called salvage surgery. Chota kar the size so that chemoradiation is effective. So we are not removing the tumor, we are just decreasing the size. So that's called salvage surgery. Done. So this completes larynx, which I told you is the most important part of the throat, more important than nasopharynx, oropharynx, and hypopharynx. In सब को मिला के larynx is more important. Meaning अगर टाइम नहीं बचता वाशरूम में तो larynx को भी करके जाना, जरूर करके जाना. और वो nasopharyngeal का आसना जरूर करना. Tonsil के ट्रीट nerves artery supply and tonsillectomy जरूर करना. ठीक है? Throat is not complete. Throat is complete if we talk about tracheostomy. And tracheostomy, only 3 points. You know what is the meaning of tracheostomy, isn't it? Making an opening in the trachea. And the main reason is to bypass the larynx. Why we do it? To bypass the larynx mainly. अगर larynx बंद हो गया तो उसे bypass करना है. What will close the larynx? Which means obstruction of larynx. Usually due to carcinoma of larynx. Basically, what I'm trying to say is, when they ask you the indication for tracheostomy, all these are correct answers. Bypass the larynx or obstruction of larynx or carcinoma, they are same thing, similar thing. They are all correct answers. Preferred site. Preferred site for tracheostomy is tracheal ring 2 and tracheal ring 3. Ring 2 and ring 3 are the preferred site for tracheostomy. Ring 1 में नहीं करते. Ring 1 में नहीं करते. If you do in ring 1, it's called high tracheostomy. ये wrapper को वैसा मत करो यार. Really, this wrapper of coffee, it gets onto my skin, in nerves. इसकी आवाज मेरे को ना एकदम अंदर से वो है. So I can, तो दूसरे wrapper खोलता है तो I can, my senses will pick it up. और अंदर से ऐसे होता है तब. I can't tolerate it. So what is high tracheostomy? When you do tracheostomy in ring 1, and there's only one indication for this, and this is MCQ. What is the only indication for high tracheostomy? Laryngeal carcinoma. So this is another very important MCQ. What is the indication of laryngeal high tracheostomy? Laryngeal carcinoma. And the last thing is complications. The most common complications are one of the two, either dislodgement of the tube or bleeding. Both are common complications. Do we have a question? That is the correct answer. Subcutaneous emphysema brother. This is the most common complication in children. If they ask you which is the most common complication in children, then of course you say difficult decannulation. Tracheostomy few points only, not too much, so easy to remember. And this completes throat. Unless of course you have any question or doubt on the throat. Otherwise, we are going to start with nose and sinuses. The last one. Now, let me tell you something about this topic. Make break may decide करूँगा. Listen to me. Compared to ear and throat, nose is very small, very small. Like ear का 25% भी नहीं है, throat का 30% भी नहीं है, throat का half भी नहीं है, इतना छोटा है. And it is easier compared to ear and throat. It is easy, very easy to remember. But questions almost equal are. Suppose if I have to prepare a question paper of ENT, where I am allowed to prepare 15 questions, आज के 5 लगा देते हैं. Ear, nose, throat, बराबर. But फिर आई को लगे कि नहीं ear बड़ा है तो इसमें 6 कर देते हैं, यहाँ से कम कर देते हैं, है ना? 15. So this is 2/3 of ear. Ear 6 और ये 2/3 है. लेकिन कितना टाइम लगता है इसको करने में? टाइम 25% लगता है, क्वेश्चन 67% आते हैं. आइडिया नहीं पर 25 पैसे देखिए, 60 पैसे का 70 पैसे का आपको वैल्यू मिलती है. लेस इनपुट, बिजनेस, गुजराती. So what I'm going to say indirectly is that never ignore nose and sinus. I see lot of people thinking यार ये इसको छोड़ो ना body भी है छोटा सा दिया काम करेगा, but no, questions आते जरूर हैं and the easier question maybe out of these 6 questions you will never get all 6, you will get only 5 correct most of the time. इसमें आपको 4 है लेकिन always you get 4 correct, always if you pay it. So चलिए को और भी फायदा इसलिए नोज एंड साइनस कभी ब्रेक नहीं मांगना, कभी छोड़ना नहीं और आराम से करना. So that is what we are going to do. We are going to complete without any break. That's what I'm saying. So ये भूमिका थी. Okay, what is the shape? What is the shape of nose and sinus? Nose is described as a small pyramid. This is described as a small pyramid. And of course, when you look at the nose in the front, you can see it's like a small pyramid. And that is why when you cut the nose commonly, like this, and look at the nose of the front, is called anteposterior groove. I draw the nose like this. Actually, as a nose, if you cut it, it's actually like this. But we know that it is divided into 2 equal halves by a boundary in the midline. This is called nasal septum. The boundary is called nasal septum. We know this. So this is an APV, anteroposterior groove. But if you look at the nose from the side view, so laterally, it looks quite different. I told you, anatomy is about view, isn't it? Side से face कैसे बनाते हैं? From side, the face is like this. We have done this, isn't it? If I remove everything except the nose, I remove the eye, the face, this, क्या बचा? This is how the nose looks from the side. The first one is the front view, the second one is the side view, and they look so much different because anatomy is all about view. So, can I say this is the roof, which is same as this? This is septum. This is the posterior wall. Posterior boundary of the nose, posterior wall of the nose. इसका नाम है. Posterior wall of the nose is called. बताया मैंने इससे कुछ. तुम बताओ. कौन था? तुम बताओ. Posterior wall of the nose को क्या होगा? सोचो क्या था? बोलो. कोई है ना? याद आया? कोई है ना? कोई है ना? It's an open door between nose and nasal. इसके पीछे nose sir? So we know this already, and we discussed voluntary and all that. So obviously. Now let us talk about the roof of the nose. The roof of the nose is made up of 2 main bones. The 2 main bones of the roof are preform plate and fovea ethmoidalis. These are 2 bones on the roof of the nose, preform plate and fovea ethmoidalis. And what kind of epithelium lines the roof of the nose? The epithelial lining, tissue lining. बताओ. Olfactory epithelium. We all know the roof of the nose has olfactory epithelium, the one that is responsible for the sense of smell. The olfactory work. We know this. Now, related to the roof of the nose, this is anatomy. There are 3 things you have to know. 3 things. Number 1, this is important. See, roof of the nose, which is olfactory epithelium, is made up of many types of cells. The main cell, which is actually responsible for olfaction, is called receptors. This is the main one. इसके बगैर आप smell नहीं हो सकते. This is the main. But it is supported by a cell called supporting cell. As the name tells you, this is going to support the receptor cell to help you olfaction. Supporting cell. And there are few more. We are not going to deal with the rest of them. These two are important. Now, why is supporting cell important? Because supporting cell has receptors called AC2 receptors. Supporting cell have a receptor called ACE2 receptor. Now, why is ACE2 receptor important? COVID virus COVID-19 को बोलते हैं. It binds the cell via ACE2. इसके थ्रू वो bind करता है, and through this it enters the cell and damages the cell. So any cell which has ACE2 receptors will be attacked by COVID virus and will be damaged by the COVID virus. And that's why your supporting cell of the olfactory epithelium will also get infected and damaged by the COVID virus. And if supporting cell is gone, the receptor cell is stops functioning. And the patient will have a loss of sense of smell. What is it called? Anosmia. It's called anosmia. So COVID patient will have anosmia as one of the features. And you all know this is true. That in the first day especially, most of the patients had anosmia. Sometimes it was the first symptom. But the good thing about supporting cell is that supporting cell has a very high regeneration value. नया बनता रहता है. एक basal cell भी होता है. I did not mention there is a basal cell that matures and becomes supporting cell. So if your supporting cells are gone, they are there. Don't worry. आगे नए cells आएंगे supporting cells. So when the infection is gone, the new cells will come and they will start supporting the receptor cells, and the olfaction comes back again. Smell comes back. And that's why we all know that most of the patients of COVID with this anosmia, they become normal in few weeks and months time. Most of them. So this is the reason. So this is why this is important, because of the current situation. So it's a potential question. Second thing about the roof we have to know is that in the roof, a tumor can arise from this olfactory epithelium. And they ask you the name of this tumor from the olfactory epithelium. It is called neuroblastoma. Just remember the name of the tumor and the fact that this tumor arises from the olfactory epithelium. So they can ask you whether the tumor arises from the olfactory epithelium, then before it, they look at neuroblastoma. And the third point is, the third thing you have to know is sometimes this cuneiform plate gets fractured. So if there is a fracture of the cuneiform plate, what will happen? CSF will start flowing from the nose. And if the CSF starts flowing from the nose, what is it called? CSF rhinolia. So fracture of the cuneiform plate may cause what is called CSF rhinolia. And CSF rhinolia, you have to know 4 to 5 months. It's a very, very important. Important points from CSF rhinolia. One, you know, cause. What is the cause? Surgical fracture of cuneiform plate. This is the most common cause of CSF rhinolia. surgical fracture of the profound. Most commonly cervical fracture. Most common, okay. Most common cause is cervical fracture of the profound. It can be any fracture, but most commonly is cervical. Now, you know what is the main clinical problem when the patient has a CSF aneurysm? The patient comes to you, having CSF aneurysm. What is the main challenge as a clinician? Is the fluid that is flowing from the nose CSF or nasal discharge? Nasal discharge कैसा लगता है? CSF भी कैसा लगता है? और आपको पता है कि ये CSF आ रहा है नाक से कि nasal discharge आ रहा है? How to differentiate? And if you read your books, there are many points. Most of this is not useful for you. I'll give you three important things that happen, which are very, very important. Number one, CSF has a sign called target sign, which is also called halo sign. This sign is seen in CSF, it is not seen in nasal discharge. This is point number one. Point number two, the glucose content. The glucose content of CSF is more than 30 grams. Nasal discharge में 12 ग्राम से कम होता है, 12 ग्राम. So which is more sweet? CSF is sweet. If you read the books, there says CSF is sweet and nasal discharge is salty. मेरे को लगता है किसने चेक किया ये. But that's not his great purpose. CSF is called sweet and nasal discharge is called salty. याद रखने के लिए. But the third one is the most important one. Presence of beta-2 transferrin. This is very important because this is the most specific indicator of CSF, and this is very, very important. Remember this extremely important point. The most specific indicator, again, the specificity and sensitivity. Point is that if you find beta-2 transferrin, there is no down left. The fluid is down and down. But investigation of choice is something else. What is the investigation of choice? Either high resonance CT scan or MR cystoscopy. Both are correct answer. CT scan is a better answer. This is a better answer. And the last one is the treatment options. Conservative management. Nothing needs to be done. Conservative is two things: bed rest with head up position and antibiotics. When we say conservative, no surgery, no repair. तो प्रोसीजर नहीं करना. एंटीबायोटिक दो विच बोल के 2 हफ्ते तक लेटे रहो, सर्व हो जाता है. That's it. So very few points, I told you 4-5 points, 3-4 points, but very important. So these are the main points on the roof of the nose, that supporting cells, COVID, esthesioblastoma, CSF binary, and all that. And then we talk about the medial bone. What is the medial bone? Septum. Medial bone is septum. Side से ऐसे लगता है. Septum from the side looks like this. From the front it looks like this. From the side. Right. Now what is septum made up of? It's made of 7 bones and 3 cartilages. Nasal septum has 7 bones and 3 cartilages. Total 10 things. Ideally, You're supposed to know all the 10 names, and ideally you're supposed to identify them with the image also. Ideally. But we are not ideal. हम सिर्फ शॉर्टकट ढूंढते सर हमें क्वेश्चंस बता दो बंदा तो आएंगे फिर हमारा काम है ना सर बताओ if I tell you I will give you 20 questions confirm यही आएंगे I will tell you the answer also and you don't have to pay for the class but you still attend the class I will teach you here basic एक क्वेश्चन में पहले बता पैसे नहीं लगेंगे फ्री में क्लास होगी आप तो क्या करोगे आप और दूसरा ऑप्शन है कि सिर्फ क्वेश्चन दे देंगे 50,000 रुपये लगेंगे क्लास नहीं अटेंड करेंगे कौन सा ऑप्शन लो ये 10,000 क्वेश्चन मिलेंगे 20-15 आंसर भी मिलेंगे वही क्वेश्चन आएंगे 10,000 रुपये लगेंगे वर्सेस क्वेश्चन भी मिलेंगे क्लास भी होगी क्लास जरूर करनी पड़ेगी लेकिन पैसे नहीं लगेंगे हम लोग के फर्स्ट ऑप्शन नो मनी 20 घंटे बैठे हुए यहाँ पे ENT पढ़ने के लिए लोग बस सीरियस क्वेश्चन है मजाक नहीं सीरियस क्वेश्चन कितने लोग ENT पढ़ना चाहते हैं शॉर्ट में सो मोस्ट कंप्यूटर के सेकंड ऑप्शन 10,000 देंगे क्वेश्चन तो आगे जाएंगे है ना जैसे ना सही नहीं है शॉर्टकट you all like it हाँ हाँ सुधा बिना लिख के बता दो बता दो गूगल पे या पेटीएम गूगल पे या पेटीएम कैसे आपको भेज नहीं मेरे पास क्वेश्चन है नहीं तो पैसे देकर कोई फायदा नहीं लेकिन ये कि ये पूछेगा कि सर वो पैसे दे गूगल पे देना पड़ेगा कि पेटीएम करना पड़ेगा कैश में देंगे ये भी सही है देखो ये कांट लीव दैट ट्रैक ये तो इलीगल काम है तो कैश ही होगा सारा कुछ इलीगल सारा काम होता है ओके नाउ आउट ऑफ द 10 नेम्स आपको सिर्फ 3 नाम पता सो शॉर्टकट वही मैं बता रहा हूं शॉर्टकट की बात हो रही Here are 3 things that you must be able to identify 1 2 and 3 so not only do you have to remember these 3 names you must be able to identify the vomer bone, the perpendicular plate of ethmoid, and the septal cartilage. Out of 10 things, 3 yaad rakhna. And you should be able to identify them as well. Now, about septal cartilage. We have to know 2 more points. Septal cartilage के बारे में one is they ask the shape and you know the shape. How many sides it has basically? कितने sides are देख के बताओ. One side is this, one side is this, one side is this. है ना? roughly. इसलिए इसको quadrilateral cartilage. It is a quadrilateral in shape. Or quadrilateral cartilage. That's one point. And the second point is the only unpaired cartilage of the nose. The only unpaired cartilage of the nose is this cartilage. बाकी जो भी cartilage नाम रखने याद रखने की जरूरत नहीं है वो सारे paired हैं in the nose. So 2 points. But talking about the septum, इससे भी ज्यादा जरूरी है the artery supplying the septum. So let's know the most important anatomy point of the septum: arteries in the septum. How many arteries in the septum? Septum has 5 arteries. 1, 2, 3. 4, 5. And you still already know the main artery, which I told you. Remember the most important artery? Which comes from here like this. Sphenopalatine artery. Is a branch of maxillary artery. We know this already. It is like this, I have shown before also. The second artery is also a palatine artery. This is greater palatine artery. Again, a branch of maxillary artery. And which comes from below like this and enters from here like this. This is your greater palatine. Your pleurisy, which is under artery. And the third is the superior labial artery, a branch of fascia. What is superior labial mean? Upper lip. Superior is upper lip. The upper lip is इसके सामने से ऐसे enter होता है. And we all know this maxillary and facial both are branched from external carotid, isn't it? So these two arteries, they carry the blood from the external carotid artery. But the next two, they carry the blood from the internal carotid, alak source. That's why I use different color. And one is called anteethmoidal artery, and one is called postethmoidal artery. Like I said, these two are from the internal carotid, and that's why I use a different color. And they come in the nose from the root. The front one, which is like this, is the anteethmoidal, and the one behind like this, the smaller one is the postethmoidal. So roughly, this is how the 5 arteries are stacked in your nasal septum. Very, very, very important. And they are not difficult names to remember. Many of us know this already because they are such a common thing. But what is even more important is the fact that out of these 5 arteries, so upper is the last one, postethmoid. The rest of the 4 arteries, they to come here together and join with each other to form a plexus. What is this plexus called? Hazelback's plexus. And this area is called Little's area. Okay, Hazelback's plexus, Little's area. And we all know the importance of this area. What is the importance? It's the most common site of epistaxis or nasal bleeding. This is the most common site of epistaxis. This one. This is a very important MCQ. Everybody knows this. Very simple question. So, which is the most common artery of epistaxis? The first artery, sphenopalatine artery. This is called the artery of epistaxis. Sphenopalatine artery is called the artery of epistaxis. Now, talking of epistaxis, so previous slide. Done? Let us know the other important points about epistaxis. So you know 2 questions already. The most common site is the Hazelback's plexus, Little's area, and the most common artery is the sphenopalatine artery. What is the cause? Most common cause is nose picking. Second most common cause is idiopathic. Foreign body is a very important cause. ये सब बच्चों में होता है. In adult it is hypertension. In adult it is usually hypertension. I already told you that bleeding anywhere is an emergency. This is an emergency. And one of the most important things you have to do is to be able to stop the bleed. And I told you, to stop the bleed, almost always the best option is apply pressure on the nose. For 5 to 10 minutes, because clotting will happen and the bleeding will stop. So how do you apply the pressure on the nose? It's called nose pinching. For 5 to 10 minutes, you press the nose like this. It's called nose pinching. If this fails, cautery with silver nitrate. Now this is another very important MCQ. For nasal cautery, what is used? Silver nitrate is extremely important MCQ. If this fails, we have nasal packing. Pack the nose. And if this fails, ligation of arteries. So it's a very similar sequence as in tonsil that we discussed. Tonsil and packing को छोड़ दो same है. Tonsil and pressure, then cautery, then ligation. Here is pressure, then cautery, then packing and ligation. Packing is the only thing, otherwise it is very similar to the. So any of bleeding, the sequence is the same. And you know what is ligation? What is ligation? You tie with thread, take a suture and ligate. And the question will ask you which is the first artery you ligate. Obviously, sphenopalatine artery because that's the main artery of the plate. How do you ligate? Look at the line. Transnasal endoscopic sphenopalatine artery ligation. This is what you do. TESPA. This word TESPA is. So what does TESPA stand for? Transnasal endoscopic sphenopalatine artery ligation. अगर वो काम नहीं किया तो next artery is maxillary artery ligation. If that first one did not work, this is a sequence. Then next option is maxillary artery. वो भी नहीं चला तो external carotid. वो भी नहीं चला तो anti-ethmoid. So which the sequence in which we ligate the artery for metastasis. The sequence in which we ligate the arteries in epistaxis is given here. First, sphenopalatine artery, then maxillary artery, then external carotid, then finally anti-ethmoid. Last one is a very important MCQ. The last one is a very important MCQ. They ask you that we have ligated, this is a question, please remember that they'll ask you that we have ligated external carotid, the bleeding continues, so the next thing you'll do. Next thing I'll do is, because this is bleeding now. See, if I use this one, if I ligate external carotid, ये वाला. If I ligate external carotid, these three cannot bleed. This cannot bleed, this cannot bleed, this cannot bleed. And this never bleeds because ये तो है ही नहीं यहाँ. क्या बच गया? this is not there. So the only option is if external carotid के बाद यही बचता है. So this is what we will ligate to the external carotid to able to stop the bleed. Right? And the last point about epistaxis is there is a disease called hereditary hemorrhagic telangiectasia. It is also called Osler-Weber-Rendu syndrome. इसमें bleeding होता क्या है? Because this is a hemorrhagic disease, so this can bleed. This is the treatment. Septal dermoplasty or dermabrasion. This is another MCQ. This is a hereditary disease, it's a congenital disease, which has a bleeding problem. So if the patient starts bleeding, what do? I do derma septoplasty or septal dermoplasty, whatever you want to say. So these are the main points about the anatomy and the bleeding and the arteries of the nasal septum. And the last boundary of the nose that we are going to deal with is the lateral wall of nose. Lateral wall. Which is the lateral wall? Lateral wall is this wall. Anna? Left, right. This is a AP view. Once again, the side view of the lateral wall is very similar to the septum. The side view is like this. Lateral wall का side view ऐसा ही है. The most important thing on the lateral wall are three projections like this. Three this side and three this side. What are the three projections called? Turbinates. Turbinates. Inferior, middle, superior. Turbinates. They are projections. So if I draw in the second diagram, turbinates, उसकी size पता चलती है. The inferior turbinate is like this. This is an inferior turbinate, so quite big. This is a middle turbinate, and this is the superior turbinate. Three turbinates: inferior, middle, superior. So now if I ask you the longest turbinate, you know the answer. Is it the longest turbinate? Inferior, as you can see, is the longest turbinate, isn't it? The rest of the area on the lateral wall, what are they called? The area bach gaya. They are called meatus. Turbinates are three. How many meatus? Turbinate three. Meatus how many? Four. Four meatus. These are the four meatus. See, look at the diagram. Below the inferior turbinate, this area is the inferior meatus. Below the middle turbinate, this area is middle meatus. Below the superior turbinate, this area is superior meatus, and the top one is supreme meatus. Inferior, middle, superior, supreme. Top one is supreme. Supreme का एक नाम हो रहा है. What is the other name for supreme meatus? It's called ethmoidal recess. Now this is a very important MC. What is sphenoethmoidal recess? They ask you, and you know sphenoethmoidal recess is the other name for supreme meatus. Three terminals, four meatus. What is the most important thing we have on this meatus? The most important thing on the meatus are the openings of the sinuses. Sinus are the into opening. What is the opening of the sinus called? Ostia. This is the main thing in the meatus, ostia. Opening of the sinuses. How many ostia do we have? It's like asking how many sinuses do we have? 5 ostia. Because we have 5 sinus. So 1 ostia for 1 sinus. 3, 4, 5. Easy to remember in that sequence. 3 terminals, 4 meatus, 5 ostia. 5 ostia because 5 sinus. Which are the 5 sinus? Name the sinus. Maxillary sinus. Okay. Frontal sinus. With anterior ethmoidal sinus. Then posterior ethmoidal sinus. And sphenoidal sinus. 5 sinus. You know these names already. And each sinus will have an ostia. So 5 ostias. And now comes a very, very important thing. Which sinus ostia is present in which meatus? This is a very commonly asked. In lateral, this is what they ask you. Which sinus ostia in which meatus? So let us start from the lower one. ये कहाँ पे है? Supreme meatus. Top one. Supreme. If you look at the image here, this is the ostia of sphenoid. Supreme meatus. And where is the ostia of posterior ethmoid? Superior meatus. Superior. Superior, yeah. This is posterior ethmoid. Very easy. सबसे ऊपर supreme as sphenoid, below that is posterior ethmoid. So how many ostia there? 3. These 3. Isn't it? They are all present in middle meatus. Meaning middle meatus will have 3 ostia. So 3 dots. Because there are 3 ostia in the middle. 3 dots. So which meatus has no ostia? Inferior meatus has no ostia. It has something else. What is the something else? Nasolacrimal duct. NLD in short. Nasolacrimal duct. NLD in the inferior meatus. So every meatus will have something. That's the important thing. Every meatus will have something. Which meatus is what you have to know. Not a difficult thing. कौन से meatus में क्या है ये भी याद रखना है. यही कहानी है lateral. That is one more thing. Behind the inferior turbinate, here there is a plexus. This plexus is called, you Woodruff's plexus, and it's a plexus of veins. Venous plexus, as we call it, plexus of veins. Woodruff's plexus. Behind the inferior terminal. So these are the main things on the lateral wall of your nose. 3 terminals, 4 millimeters, 5 ostia, these 5 sinuses, which ostia and which millimeters, and major lacrimal duct. That's it. Now, major lacrimal duct, you have to know a few more things. These are the 4 or 5 points about major lacrimal duct that you have to know. The direction. Direction is a very important MCQ. This is very, very important. Direction. It is downwards, backwards, and outwards. Downwards, backwards, and outwards. सिरिंजिंग का भी यही है क्या? खुला अपवर्ड्स होता है उसका. सिरिंजिंग में अपवर्ड्स होता है, इसमें डाउनवर्ड्स. बस यही फर्क है, बाकी दोनों सेम है. Then there is a valve called Hasner's valve. Again, you know the name. Important name, Hasner's valve. The cyst is called nasolabial cyst. The cyst is called nasolabial cyst. And when it was blocked, through a surgical necrosis or anoscopy, which is done in the middle meatus. This is another important MCQ. Where is the surgery done? The surgery is done in the middle meatus. Necrosis or anoscopy. So read this. This is important, especially the 2 MCQs that are written, the direction and the site of the surgical necrosis or anoscopy, which is middle meatus. Okay, now, so this is going to be the main things in the anatomy to know. Few things in the sinuses. Just pinch about the sinus, not too many. They ask you, which is the first sinus? Which is the first sinus that starts to develop in the human embryo? And it's the last to start. Which is the first one? Maxilla is the first to start the development. Which is the last to start? Frontal is the last to start. The sequence is this. Maxilla is the first. Then comes ethmoids. Then comes sphenoid. And the last one is frontal. This is a sequence in which they start to develop. Maxilla, ethmoids, sphenoid, and frontal. And they complete in the same sequence. Completion is a sequence. First to complete is maxilla, then ethmoid, then sphenoid, then frontal. These two they start to develop postnatal, after birth. इनका डेवलपमेंट बच्चे की पैदा होने के बाद से postnatal as we call it. So the first is prenatal. About maxilla, we have got 3-4 points. If I draw that nose like this, nose, Where is maxilla? On the sides. So maxilla is here. Both sides and then what sits on the maxilla? What is on top of maxilla? What is on the maxilla? Or it sits on the maxilla between this. So maxilla has one more name. What is the other name? Antrum of high mode. This is a very important MCQ. What is antrum of high mode is very important MCQ. It's the largest sinus. इसमें इसका वॉल्यूम पूछते हैं. Volume is MCQ. Both the MCQs, the fact that it is largest sinus and the volume, both are important MCQs. And the only other thing we ask is, what is the floor of maxilla formed by? What forms the floor of the maxilla? Alveolus. Upper jaw. Alveolus is the floor of maxilla. Okay, so these are the important points of maxilla that you need to know. Then, similarly, few points about ethmoidal sinus. And you already know ethmoids are anti and posterior. Now, the most important thing about ethmoids is that they are multiple air cells. Cells means it is cellular. It is cellular multiple air cells with many lines. If I use this diagram, ethmoids कहाँ पे होते हैं? Ethmoids are here, like this, but many cells. See, maxilla only one, big. Ethmoids are many, but very small. How many? Average is 8 to 9 cells. Ethmoids on an average is 8 to 9 cells. Now, out of 8 to 9, one of them is the largest cell. Largest. One is anterior most. One is below orbit. One is near optic nerve. And they have names. इनके नाम हैं. So which one is called by what name is a very important. So 4 names basically, remember, it's very easy. Largest is like a balloon. Balloon की तरह होता है. Bulla. Balloon is bulla of the ethmoid. It's called bulla ethmoidalis. Bulla ethmoidalis is like a balloon of the ethmoid. You know? That's what it is. So largest. Anteriormost. In Hindi, सबसे आगे वाला है ना. हिंदी में क्या बोले? आगे वाला. इसका नाम है अगार मेजर. आगार, आगे वाला. Agar measure, आगे वाला. So please do remember that. The most anterior ethmoidal cell is called agar measure. Below the orbit is Heller cell. Orbit के नीचे Heller cell. And near the optic nerve, खतरनाक एरिया. ऑप्टिक नर्व में कुछ गड़बड़ होगी तो पेशेंट की विजन ब्लाइंड. तो ये खतरनाक है. अनाड़ी है, इसको पता नहीं है कहाँ होना चाहिए. अनाड़ी है. इसका नाम क्या है? अनाड़ी से। ये अनाड़ी है, इतना जगह पहुंच गया तो अनाड़ी से। Again, very important MCQ with these problems. So in the anatomy of the sinuses, these are the two things that you have to remember. And when the sinus gets infected, क्या बोलते हैं इसको? Sinusitis. Now sinusitis and rhinosinusitis are many types, but we'll discuss only 4 important types of rhinosinusitis. क्या करोगे ब्रेक? 15 मिनट चले जाएंगे ब्रेक में. See, if you don't take break, I will leave you by 6:15. So if you take break, it will become 6:45. Simple. 6:15 goes to 6:15. So 15 मिनट को आधा घंटा हो जाता है. When it starts, तो धीरे स्टार्ट होता है. वो टाइम वेस्ट होता है ना. वो टेम्पो का होता है. 6:15 versus 7 roughly. बराबर. 6:15 है ना. ठीक है. पानी चाहिए तो मैं दे देता हूँ. वाटर वॉशरूम में जाके आ जाओ. प्लानर चाय क्या गंदी सी चीज. चाय भी कोई गंदी चीज है. 7 बजे के बाद ऐसे पीना. रात को माइक्रो तो चलता ही रहता है. माइक्रो तो बहुत सा है, वो तो डेली करते हैं. तो कितने बजे से? हाँ, तो 15 मिनट का टाइम लेगा चाय पीने का. नहीं, ब्रेक लेंगे तो 6:45 पे लगेगा. ब्रेक नहीं लेंगे तो 6:50 है ना. ओके, लेट्स सी. अगर आप लोगों से बर्दाश्त नहीं हुआ तो नहीं हो रहा. किसका ब्लैडर फटने वाला है? तुम्हारा फटने वाला. Last one is the most important. And infective reaction, first one not important. सिर्फ पता है कि first नाम का होना चाहिए. There is allergic rhinitis, there is vasomotor rhinitis. This is allergy, and all allergies are type 1 hypersensitivity. All allergies are hypersensitivity type 1. So this is also type 1 hypersensitivity. That's the only thing you have to know. And which is the most common allergen? House dust is the most common allergen. This is MC. House dust is an MC. Hypersensitivity आपको वही माइक्रो में पढ़ाया जाएगा. पैथोलॉजी में पढ़ाते हैं. All the 4 types. Now vasomotor rhinitis. I told you far. Vasomotor rhinitis is caused by median nerve. याद है median nerve? Median nerve is formed by which nerve? It is formed by the first branch of the facial nerve. What is the first branch of the facial nerve called? Parietal superficial pterygium nerve. And supplies what? Lacrimal gland and glands of nose and sinuses. So उसी से होता है. Nose and sinuses. Glands of nose and sinuses. Nose and sinus glands. That's why इसका treatment है median neurectomy. Median nerve को काट देते हैं. Median neurectomy. And this is another MC. They ask you median neurectomy is done in which disease? Median neurectomy is done for vasomotor rhinitis. So this is simple. Now we come to the main, the one that they actually ask in the exam. The next one. Infective anatomy. Now infective rhinitis, like most other infections, will be fungal, viral, and bacterial. And we have to know the two, fungal and bacterial. Fungal and bacteria are important. This we will discuss, and we'll start with fungal rhinosinusitis. Now we are talking about the real stuff that will ask you the exam. Fungal rhinosinusitis can be of 4 types. Aspergillosis, fulminant fungal rhinosinusitis, rhinocerebral mucormycosis, and allergic fungal sinusitis. I don't have to tell you which is the most common type. अब समझना आएगा होगा. The first one, aspergillosis is the most common type. Now, the first important thing you have to know is which fungus causes which of these diseases. So let us know the fungus. Aspergillosis is caused by Aspergillus fumigatus. This one, same. Mucormycosis caused by either a rhizopus or a mucor. And allergic fungal sinusitis caused by bipolaris. Now, there are the different funguses causing different fungal disease. And therefore, if I ask you which is the most common fungus causing rhinosinusitis, Aspergillus fumigatus. And the most common being the first one, aspergillosis. Now, what happens in aspergillosis is there is a formation of fungal ball in the nose. What is this fungal ball called? Aspergilloma. Okay. In aspergillosis, there is a formation of fungal ball in the nose which is called aspergilloma. Ball of fungus. All the fungus will accumulate together and become a ball. And what do you have to do now? Just remove this fungal ball. So, excision of fungal ball. All you have to do is excision of fungal ball. The next disease is fulminant fungal sinusitis caused by same pathogen, fumigatus. And the third one is rhinocerebral mucormycosis. This is either caused by a rhizopus or a mucor. So the second and third are different diseases caused by different funguses. But everything else is same for these two. सब कुछ same है. Like both are seen in diabetics. Okay, both are seen in diabetic. Immunocompromised. Diabetes से क्या होता है? Immunocompromised हो जाता है. Both are highly invasive. They invade the tissues. And they will both spread very fast. If you invade, you can spread. Obviously, if you invade and spread, you can cause a lot of complications. So both have a lot of complications. And both need the same treatment. What is the drug of choice? Amphotericin B plus surgical debridement. And for surgery is FES. Remember this name FES, we'll discuss this later on. The surgery that we have to do is FES. So everything is same for both diseases except the fungus is there. easy to remember. What is the meaning of surgical debridement? You remove the tissue which is involved. You have to remove the tissue that is involved. Now, there's something very special about mucormycosis. Mucormycosis is also same: diabetes, invasive, spares, complications, FMGE, surgical debridement. But invasive, it is angio-invasive. It is invasive, yes, but it is angio-invasive. What is the meaning of that? It invades the blood vessels. Blood के अंदर घुस जाता है, arteries के अंदर. And so it can do two things. One is it will block the artery. Artery को block करके the blood supply बंद. What will that do? That will cause ischemia. And ischemia will cause necrosis. So this is very, very special thing about mucormycosis, the fact that it can cause necrosis. What is the color of necrosed tissue? Black. So there is black tissue, black discharge and black tissue. इसलिए इसको black fungus बोलते हैं. That's why it's called black fungus. And you must have heard this name during COVID, black fungus. So this is that black fungus. Here, black fungus. That's why it is very important. This is likely to be asked in the exam, black fungus. Now the fungus is not black in color. This name is a misnomer. The fungus is not black in color. It's called black fungus because the tissue becomes black because of necrosis. Because the blood supply is at the top. So जहाँ पे भी जाएगा वहाँ पे necrosis हो जाएगा, nose and all that. And because it is angio-invasive, it mixes with the blood. The second thing it can do, it will mix with the blood and spread with blood. It will spread with blood. कहाँ? Where will it spread? Two areas: orbit and cranial cavity. So it spreads to the orbit and cranial cavity very easily because it mixes with the blood. Orbit में घुस जाएगा, brain में घुस जाएगा. और वहां जाके क्या करेगा? वही necrosis will damage the tissue. Black orbit, black brain. So you must have heard a lot of people had orbital complication with black fungus, है ना? Orbit में उसके आंखें निकलनी. So this is very common. And brain में जाना रहता है. नाक look at the name, rhinocerebral mucormycosis. What is the word rhinocerebral used? नाक से brain में is very common. Right. So this is very, very important. That's why in the COVID patient, lots of patients had orbital spread of mucormycosis, and very few had cranial spread also. अब करना क्या आपको? करना क्या? और M4 B plus debridement, है ना? Debridement का मतलब उस टिश्यू को निकाल दो, हाइट दो. अब यहाँ क्या निकालोगे? आँख में चला गया तो क्या निकालोगे? आँख निकाल लो. So if the orbital spread happens, you have to remove the orbit. आँख निकालनी पड़ेगा. It is called exentration of the orbit. You have to do exentration of the orbit. तो ये आपको निकालना पड़ता है सही है. गया. इसलिए आप बचा नहीं सकते. Right. एंड कोविड में इंडिया में कम से कम 10,000 लोगों की आंखें निकली, कम से कम. एंड मेनी ऑफ देम वर बोथ आईज with bilateral spread. And lot of these were young people. Lot of young people had orbital spread. और कुछ लोगों ने थोड़ा सा वो किया कि आंख बचाने की कोशिश करते हैं, because दोनों आंख निकालेंगे तो सारी जिंदगी यंग है, आंख तो निकाल दोगे, ब्रेन में चला गया तो क्या निकालोगे? Get the point? So it's very serious. तो इसमें वही you cannot be empathetic, कि आप दया नहीं कर सकते डिजीज के साथ, दया नहीं चलती, you have to be aggressive, and in mucormycosis we have to be very aggressive, and that's why because we already know this from before, so right from the beginning when we realized mucormycosis is very common, we started doing all the surgery, and that's why by the time it was full fledged, we were able to control a lot of mucormycosis. काफी अच्छा कंट्रोल हो गया था, तो बाद में लोगों को प्रॉब्लम नहीं हुई. So essentially because of N-4B, it's a very effective drug in this patient, and a lot of surgeries were done in mucormycosis. And I feel that इसमें से क्वेश्चन जरूर आएगा, कुछ ना कुछ mucormycosis से, black fungus से. And if you want to know everything, I have a video on YouTube on mucormycosis. करीब 1 घंटे का वीडियो है, उसमें सब कुछ everything that you need to know is there. If you watch that video, there is nothing else you need to know. But this is okay. If you don't want to spend time, this will help you. And the last fungus is allergic fungal sinusitis. So the person is allergic to the fungus. Which is the fungus? Bipolaris. And because it is allergy, this is also type 1 hypersensitivity. Okay, this is also type 1 hypersensitivity. Presentation. How does it present? Nasal polyps with calcium deposits. Is nasal polyp with calcium deposits. Which means there is a polypoid growth in the nose, which you can see very easily. When you have polyp in the nose, you can see very easily examine and diagnose polyps. But this polyp is क्या? Calcium अंदर. But calcium you can't see because it is inside. And therefore, when you examine the nose, you don't know polyp इसका है कि normal polyp. और भी polyp होते हैं बिना fungus के. The difference between any other polyp and this polyp is calcium. And that's why CT scan becomes important. On a CT scan, what do you see? You see a density of the polyp and density of calcium. अलग-अलग density. Calcium is hard, radio dense. So दो density दिखती है. This is called double density scan. Very important. In a normal polyp, you will see single density. In allergic fungal sinusitis, you will do double density. It is also called heterogeneous. Heterogeneous means more than one, treatment. Steroids plus FES. Again, FES surgery plus steroid. Why steroid? Allergy means steroid is the best thing. So, steroid plus FES. Now, these are 3 CT scans of the sinuses. They all CT scan of the paranasal sinus. Even the first one, it is normal. Can you identify the maxilla? This is the maxilla. And black and the normal. This is ethmoid. Black का मतलब normal. So this is normal CT scan of the sinus. Look at this one. Polyp. But look at the density. It is same density throughout. The whole polyp as single density, homogeneous. Wo kya tha? Heterogeneous. This is homogeneous. This density and brain ki density is very similar, soft tissue. So this is a normal polyp in the maxilla versus this one. Look at the polyp. The white क्या है? ये calcium है, bone जैसा. So this is called double density scan. Heterogeneous. So the point is that you must be able to differentiate a normal CT scan of the sinuses versus a polyp versus a fungal sinusitis with double density scan. In your exam, they have not given the image so far, but they have asked what is double density scan seen in. This is the following condition: double density scan as a question. The answer is fungal sinusitis. So this will complete fungal sinusitis. Bacterial sinusitis. Which can be acute and chronic.
Sir, 5 minutes. 5 minutes.
5 तो नहीं फिर 10 मिनट पहले. Sinusitis is less than 4 weeks old and chronic is more than 12 weeks old. Less than 3 weeks, more than 3 weeks. The first thing they ask you is the pathogen. Acute is called by 3 pathogens. Constantly, the same that also causes ASU. What is ASU? Strep pneumonia, pneumococcus, Haemophilus, and Moraxella. If you have to pick one name, the first one. Same in ESU as well as in acute sinusitis. The one name is Streptococcus, but usually there are 3 pathogens. Chronic is caused by Staph aureus. What is chronic? Proteus media caused by Pseudomonas. Where is Pseudomonas? This is Staph aureus. Now, besides these 2 which are main, there is something called recurrent also. Recurrent and subacute. Now, these 2 you can ignore. So, you have to know only the chronic and the acute sinusitis. And rest of the 2 can be ignored. Now, second thing they ask you is, which is the most common sinus involved in sinusitis? Which is the most common sinus involved? It depends on the age of the patient. Is it an adult or a child? Very interestingly, we are talking about sinusitis. Sinusitis in adult is mostly seen in maxilla, maxillary sinus, and sinusitis in children is mainly seen in ethmoids. Adult, maxilla, ethmoids, children. Lekin, after this we are going to talk about polyps. When we discuss polyp, we know that in polyp the reverse is true. That means polyps in adult is seen in ethmoids and polyp in children is seen in maxilla. So if you remember this point that sinusitis or polyp ulta hota hai in children and adult, you can remember it and they are asked in the exams. That's why you have to know this. Now you might wonder, why is ethmoidal sinusitis more common in children? In children, why is ethmoidal sinusitis most common as compared to maxilla or frontal or sphenoid? What is the reason for this? The Remember, which is the first sinus I told you which starts to develop? Maxilla. And which is the first to complete? Maxilla. Maxilla is the first to start and first to complete. So throughout your life, maxilla is the most developed sinus throughout the life because it's the first, it's running the fastest. But between the start and the finish, its mind begins to run faster. And it catches up the maxilla and becomes more developed than the maxilla also. So when we are born, until about say 8-10 years of age, the most developed sinus is the ethmoid sinus. This is the most developed sinus in children basically. More developed than the maxilla also, despite the fact that maxilla is the first one to begin development. And the ethmoid also, it's harder basically. And the sinusitis is only possible if the sinus is developed with the mucosal function. Otherwise, you cannot have a sinusitis. But after about say 7-8 years of age, again the maxilla beats the smaller sinus, and the finishing line may maxilla pehle pahunchta. So maxilla is the first to complete the development also, which is around say 12 to 13 years of age. So now this is an MCQ that why should child have ethmoidal sinusitis more common than the maxillary sinusitis, despite the fact that maxilla is the first to start and first to complete. Because some point in time in between, this is the most developed sinus. And what is this age? From birth till about 7-8 years of age. This is the most developed sinus. But polyp, as I said, will be reversed. Right. Now, symptoms of all the sinuses are pretty much same. We all know, like we discussed in tonsils also, there are so many types of tonsillitis, but the symptoms, presentations, for most of them are same. So what is the most common presentation for any rhinosinusitis is nasal blockage with nasal discharge. This is the most common presentation in any rhinosinusitis. Besides this, we can have so many other things like anosmia, loss of sense of smell, foul smell from the nose is a possibility. Congestion in the nose. And the diagnostic finding. This is important. Diagnostic finding is clinical. This is clinical finding we're talking about. Is pus in the middle meatus. Now this is an MCQ. What is the diagnostic finding of sinusitis? Pus in the middle meatus is the diagnostic finding sinusitis. Investigations. What are the investigations you do? If I ask you the investigation of choice, the answer is plain CT scan. Non-contrast. Plain is non-contrast CT scan. इसको NCCT बोलते हैं ना? Same thing. You can do endoscopy. You do endoscopy in the nose and you can see the pus. ये वाला. If both are not possible for some reason, either because you are posted in a very remote center, जहाँ पे ये है नहीं, or the patient cannot afford CT scan or endoscopy, you can go for X-ray. The last option. Right. But interestingly, the question they ask you in the exam is about X-ray. Question is about X-ray. And this is one of the most important topics from the nose. X-ray is the post-ray, बहुत common here. And there are 2 or 3 views of the X-ray. What are the views? How they are done? Which sinus is best seen? What view? That's what you have to know. So can you tell me some of the X-ray views for sinuses? कोई view पता आपको? I can hear Waters view, PRA's view, and Cardwell's. These are the 3 X-ray views that you have to know. They are very important. I'm telling you, this is the most important thing in sinusitis. X-ray views. Now, Waters view is called mental occipital view or mento-occipital. And PRS view is same, mento-occipital. What is the difference? With open mouth. This is the only difference between the two, that in one the mouth is kept open, in the other mouth is not kept open. This is for maxilla. You see maxilla best. In this you see all sinuses, including sphenoid. You can see all sinuses, including sphenoid, in your PRS view. Cardinals is an antero-posterior view, and this is done for frontal sinus. This question I thought exam. This was asked 3-4 years back, that for frontal sinus will be the best X-ray view, and the answer is Cardinals. Now, till now, in the exam, they have never shown me the image of the X-ray, but it's a likely question. They can give the image also. So I'll show you the images of these two views. How does the Waters view, PRS view, and Cardinals view look like? See, this is how, look at the first image. This is how mental occipital view is done. Mentum to X-ray view. This is the mentum. और ये ऑक्सीपिट से रे आ रही है, मेंटो ऑक्सीपिटल व्यू इसलिए बोलते हैं. But in this image, you can see the patient's mouth is kept closed. So this is Waters view being done. Waters view, जो देखने में ऐसा लगता है. And this is PRS view. Look at this. Mouth is kept open in the PRS view, and in Waters view there is no mouth. So that's the difference between the two. It's very easy to diagnose. And this is the maxilla, which is best seen in both the views. This is an maxilla, which is best seen. So please identify the PRS view and Waters view from the open and closed mouth. That is one thing. And this is Cardwell's view. AP, you can make out this straight. And this is a frontal sinus that you can see on an antero-posterior Cardwell's view. Okay? Antibiotics and decongestants and all that. And second line of treatment, if the medicines fail, is surgery. Surgery is the second line of treatment. Now the question they ask me is from the surgeons. 2 or 3 names here. This is the first surgery done for sinusitis. The name of the surgery is antral lavage. If I ask you नाम से बताओ ये सर्जरी कौन से साइनस की है? मैक्सिलरी साइनस. क्यों? एंट्रम, मैक्सिला का नाम याद है? एंट्रम ऑफ हाई मोड, एंट्रम वहीं से आता है ये नाम. So this is surgery of maxilla. Yes. The second surgery we started doing is called Cardwell surgery. ये दोनों मैक्सिला के लिए करते हैं. Both the surgery are done for maxilla only. और कई बार कंफ्यूजन हो जाता है. Look here, कार्डवेल एक्सरे किसके लिए करते हैं? फ्रंटल के लिए. लेकिन कार्डवेल सर्जरी किसके लिए करते हैं? Don't get confused. Okay, remember this. And FES, latest and best. ये किसके लिए है? कौन से साइनस के लिए? All. This is for all the sinuses. That's why it is best. So out of many surgeries, these are the 3 names in sinuses that you must remember. And these are the 2 advantages of FES and the full form of FES. You will be surprised to know कि FES का full form भी पूछा होगा. What does FES stand for? So it can be that simple. A लोगों का फिर भी गलत हो जाता है. What is the answer? Functional endoscopic sinus surgery. Functional endoscopic sinus surgery is FES. And these are the advantages. First line मैंने बताया आपको, all sinuses. Almost all indications, lot of indications for FES. Few complications, hardly any complication in FES. No scar, obviously endoscope में scar होता ही नहीं है. And tissue damage is minimum. First points. And then we talk about the most important rhinitis that you have to know, atrophic rhinitis. It is also called Oceana. It is also called Oceana. This name is an MCQ, Oceana. So once again, cause. Atrophic rhinitis can be caused because of many problems. Out of these three that you have to remember, what is the most common of the lot? The most common cause is decreased estrogen. And estrogen is a hormone. So people, you might read hormonal cause. So it's same thing, hormonal cause. Second is decreased vitamin D. It is a vitamin D deficiency. And third, Klebsiella ptomaine. These are some of the causes of atrophic rhinitis. And now you know how you get this name. The name कहाँ से आया? यहाँ से आया. Right? Then presentation. Most common presentation is nasal blockage. And they ask you क्यों होता है nasal blockage? It is due to crust formation. There is a crust formation, and this is what causes the block of the nose. The nasal blockage is due to crust formation. But there is a very special complaint which is very commonly asked. It's called merciful anosmia. This is very important. Merciful anosmia is a feature of this disease. Merciful anosmia is a feature of atrophic rhinitis. Once again, it's a clinical diagnosis. आपको कोई investigation करने की जरूरत नहीं है. If you do rhinoscopy, you can see everything, atrophy and all that. And then treatment. Treatment में से बहुत सारे questions आते हैं. Now, one of a very popular treatment is called alkaline nasal douche. Douche means cleaning. It's a Russian word. Those who are from Russia will know douche is shower. So it's like same thing. You shower the nose with alkaline solutions. It's called alkaline nasal douche. And it has 3 salts of sodium. And they are BBC. BBC. The first B stands for bicarbonate. Second B is biborate. And C is chloride. Very, very important. This is one of the most common MCQs from this disease, the content of alkaline nasal solution. Bicarbonate, biborate, chloride. And then you have surgeries also. What are the surgeries we do? One is called Young's operation. Modified Young's operation. And Lawton-Slager's surgery. Young's operation, modified Young's operation, and Lawton-Slager's surgery. These are some of the options. Just a simple disease, few points, but very important, all of them. And this will complete all the important points about rhinosinusitis that we have to know. I told you the next topic is going to be polyps. What is, I told you nasal polyps are very common. Now the main property of nasal polyps is that nasal polyps have poor blood supply and poor nerve supply. Because it has poor blood supply, what should be the color of nasal polyp? Pale, obviously, and they do not bleed. Bleeding from the nasal polyp does not happen because, as I said, and because the nerve supply is poor, they are painless. So these three are properties of nasal polyp. They are the main properties of nasal polyp. Site. Most common site is middle meatus. This is the most common site. If you remember, adult में कहाँ होता है और बच्चों में कहाँ होता है? Adult is ethmoidal polyp, ethmoids, and in children, maxillary. We know this. Opposite of sinusitis, है ना? Maxillary polyp के दो नाम और हैं. What is the other name for maxilla? Maxilla is called antrum. याद है? So it's called antrotonal polyp. It is also called Elian's polyp. They are same thing. Maxillary polyp, antrotonal polyp, Elian's polyp, they are same thing. Elian's dehiscence तो याद होगा. याद है? Elian's dehiscence between which two muscles? Raise your hand. Who knows? कौन पास बोलो? This is cricopharyngeus and pyropharyngeus, है ना? Both are part of inferior constrictor. वहाँ पे एक वो बनता है, diverticulum. कौन सा? Zenker's diverticulum. Right. This is Elian's polyp, maxilla. Cause. The most common cause is allergy. And the second most common cause is infection. These two are the most common cause of nasal polyp, allergy and infection. And nasal polyp is also seen in some syndromes. इसको मैंने टेढ़ा हूं ऐसे, मेरे को लगा था मैं ऐसे कैसे बैठा हूँ, फिर लगा मैं तो ठीक हूँ, ये ठीक नहीं। So besides these two causes, which is allergy and infection, nasal polyp can be seen in syndromes also, and this is in polyp. Here are these syndromes with polyps and other features, and this is very, very, very important. Samples triad, Cartagena syndrome, and Young syndrome. Here are syndromes. All the three are syndromes. Samples triad is also a syndrome. Cartagena syndrome and Young syndrome लिखा हुआ. And all three are key features. Polyp is common to all three. Polyp is the only common thread between the three. The last two also have bronchiectasis common. Second and third one, bronchiectasis also common. Very, very important. Polyp is इसमें dextrocardia हो जाता है. Youngs में first person polyp and azoospermia is listed infertility. Young surgery कहाँ थी? Young syndrome तो ये young surgery atrophic rhinitis. Young surgery and modified young surgery. और what was the third surgery? Young's modified young और एक नाम था Lawton-Slager surgery. Lawton-Slager surgery. And the last, once again, you make two columns. And talk of the difference between macropolyp and polyp. We already know the names of macropolyp, macropolyp, image polyp. And as you can see, the polyp is also called bunch of grapes. And one difference we already know. First one, we know that macropolyp bacteria is polyp adult. This we know already. We have done this. The first one. Macropolyp polyp is caused due to infection. The polyp is caused due to allergy. And if you have these two important causes, allergy and infection, antibiotic. And for polyp, we have to do surgery called PLS. It's very easy. Antibiotics and PLS. और गैस करके बताओ इस मॉडल में क्या करेंगे? Allergy is the cause. So steroids plus PLS. PLS दोनों में करना पड़ता है ultimately. But एक में एंटीबायोटिक देंगे, में स्टेरॉइड देंगे. Because for allergy, steroid is the best option we have. But this one, recurrence is very common. We know that by nature, it's a recurrent polyp. अगर वापस आ गए तो क्या करोगे आप? आपने मैक्सिमम स्मॉलर पॉलिप में सर्जरी कर दी, फेस स्टेरॉइड दे दिया, फिर से आ गया. अब क्या करें? ना रहेगा बांस, ना बजेगी बांसुरी. तो क्या करोगे? इथमाइडेक्टमी. इथमाइड होगा ही नहीं तो इथमाइड पॉलिप कहां से आएगा? है ना? अब धन्यवाद. So it might happen. This is MCQ. Actually, this is MCQ. That's why all this drama. So difference between the two polyps are very important. Usually they give you which are the polyp is not a picture of negative polyp. तो तीन यहाँ से देनी है, वहाँ से दे देनी है. And what follows are very simple 2 or 3 diseases, those are 3 points only, like DNS. What is DNS? Deviated nasal septum. याद है septum ऐसे होता है straight, but sometimes the septum is not straight, it is like this, and this is called DNS. As you can see the image also DNS. एक तरफ की cavity ज़्यादा है, एक कम है. So what is the most common cause? Is birth trauma. Trauma during the birth, at the time of birth basically, is the most common cause of DNS. And what is the main presentation? Nasal obstruction or blockage, obviously. This तरफ कौन है? Same side as DNS, the opposite side of DNS. ये same side है, ये opposite side है. Same side, the opposite side. Same side, obviously, it's the space कम हो गया ना? So mainly on the same side, which is understood. But sometimes on the opposite side also. Mainly on the same side, but sometimes on the opposite side also. And ये क्वेश्चन आता है कि opposite side में जहाँ पे जिस स्पेस ज़्यादा है, वहाँ ब्लॉक क्यों होगा? What is the cause of this? Look at the diagram that I've drawn. Here are the 3 turbinates. The inferior turbinate hypertrophies like this to compensate for the extra space. So this is called compensatory hypertrophy of inferior turbinate. This is the cause of obstruction on the opposite side, and this is MC. Compensatory hypertrophy of the inferior turbinate causes obstruction on the opposite side of DNS. Is a very, very important question. इसके अलावा DNS will cause many other, anything in the nose can happen with DNS. नाक की disease, नाक में कुछ भी हो जाए, समझ नहीं आता. But some people begin to have headache. वही बेगानी शादी में अब्दुल्ला दीवान, यार है? वही बात है. नाक की डिजीज में सर में दर्द क्यों होगा? वही जो थ्रोट की डिजीज में कान में दर्द क्यों होता है? वही बात. What is it? Referred pain. This is a referred pain. Neuralgia. और उसमें जरूर एक nerve होती है. तो they ask which nerve now? Which nerve? Anterior ethmoidal nerve. This pain is caused by anterior ethmoidal nerve, and that's why this pain is called anterior ethmoidal syndrome. This pain is called anterior ethmoidal syndrome. So if I ask what is anterior ethmoidal syndrome, you say it is a headache in DNS due to anterior ethmoidal nerve. So referred pain in the head in a DNS due to the nerve called anterior ethmoidal nerve. So उसे nerve के नाम से इसको anterior ethmoidal syndrome के नाम देते हैं. So once again, DNS is a very clinical diagnosis. साफ दिख रहा है. है ना, easy, so no investigation is required, but there is a test they ask to the image, ये test जो DNS में कर सकते हो आप. This test is DNS, so DNS is called Cotter's test. Cotter's test is a test for DNS. You don't have to know the details of this. Just remember the image, इस टाइप की कोई image होगी, and the name is Cotter's test. It is done for DNS. Treatment. There are two surgical options we have. The surgery of choice is septoplasty, and the second option is submucosal resection, in short SMR. They are done after 17 years. We don't do this surgery at a child whose age is less than 17 years. We wait for the child to complete the 17 years and then maybe do any of the two surgeries that we desire. अब सवाल ये मुझे 17 साल तक क्यों रुकते? Because the septum completes the growth by 17 years. वैसे याद है साइनस साइकिल 12 years में complete होता है. वैसे septum completes the growth by 16-17 years. So we wait for the completion of the growth. एक बार पूरा हो जाए, उसका मन भर जाए, अब हम लोग ठीक करेंगे. पता ना? जब मम्मी बहुत खून तक आ जाती है, बच्चे बोले जितनी शैतानी कर ले बेटा, एक दिन तो ऐसा सीधा करूंगी तो तू याद रखेगा मेरे को. पता ना? तो वही यही जितना पूरा होना हो ले, एक बार ऐसा सीधा करेंगे, उसके बाद तुम पेड़ा नहीं हो सकते. Because if you do less before 17 years, it is still growing, but again it will become the end. फिर से हो जाएगा पेड़ा. तो वे जितना होना हो जाए एक साथ करें. So that's the whole idea. Moreover, if you do a surgery on the growing bone, वो टेढ़ी मेढ़ी हो जाती है. It starts growing in a different direction. तो उसकी शक्ल चेंज हो जाएगी. Like if you do maxilla grows by 12 to 15. तब 12 साल के लड़कों में एक तरफ की मैगला की सर्जिकल होगी तो वो छोटा हो जाएगा, ग्रोथ ये बढ़ जाएगा, नॉर्मल हो जाएगा. So एक तरफ face small one, so it is cosmetically not symmetrical. So that's the main reason why we don't do surgery on the growing bone, that there is a cosmetic asymmetry on the two sides, and this is the main reason why we should wait for the completion of the growth. So हर bone की growth का होती है आपको पता होना चाहिए, which is orthopedics में बताते भी हैं वो सभी bones. So that's why this is important. So it's a very simple disease, DNS. Then we talk about 4 diseases with similar sounding names. Rhinolith, rhinophyma, rhinoscleroma, rhinosporidiosis. क्या बात करेंगे ना अभी क्या? They are absolutely different from each other. They are not common disease. There is nothing common. So rhino एक word है जो common है, इसलिए एक साथ मैं बोलता हूँ, but they are different diseases. इससे ज्यादा rhino सिर्फ काजीरंगा नेशनल पार्क में मिलता है. सुना काजीरंगा नेशनल पार्क, पता है ना कहाँ पे है, कौन से स्टेट में है? असम में है. Very big, very famous national park, Kaziranga National Park. This is famous for single horn rhinos, single horn rhinos. And because this is born in Nepal, so Nepal में भी होता है. And the area of the Nepal which has the same rhinos is called, बोलो, भरतपुर बोलते हैं. एक इंडिया में भरतपुर है, नेपाल में भी भरतपुर. वहाँ पे मेडिकल कॉलेज भी है. मैंने वहाँ पे क्लासेस ली है बहुत सारी भरतपुर में. I used to go from India to काठमांडू, और काठमांडू से एक घंटे की फ्लाइट होती है छोटी वाली, और उसमें ऐसे ऐसे अब गया तो तब गया, जान यहाँ पे अटकी होती है. वो छोटी सी फ्लाइट है और पहाड़ है, तो वो फ्लाइट ऐसे मतलब कि ऐसा लगता है अगली बार नहीं आएंगे बस लास्ट में, फिर अगली बार तो इस बार नहीं आएंगे। लेकिन नेपाल में कैसीनो होते थे, है भी क्या, तो वो अट्रैक्शन था कि घर से जाने नहीं देते थे काठमांडू, तो काठमांडू जाके रात को कैसीनो में सारे रात खेलते थे और फिर सुबह क्लास को देनी है तो लेना ही पड़ेगा। इसका दूसरा नाम क्या है, इसका I forgot the name, मतलब भरतपुर में बोलते हैं, उसका एक और नाम है पार्ट कैसीनो का नहीं, भरतपुर का कैसीनो इस पार्ट है ना। नहीं, काठमांडू में तो डांस करते हैं, बॉलीवुड डांस होता है और थोड़ा खेले तो वो बीएनओ फ्री में देना शुरू कर देते हैं। चलो एनीवेज, कमिंग बैक टू राइनो। उसके बाद राइनो बस नहीं होगा, ये दो जगह राइनो मिल जाएंगे, एक पेंटिंग होता है, एक राइनो दूसरा असम में होता है। असम में रॉयल बंगाल टाइगर की बॉल in the same part, you must have seen a video of a tigress, हाथी में बैठ के बंदा वो जा रहा था तो उसको jumps, you must have seen इसका हाथ, so that is Kaziranga National Park, but it closes in summer in monsoon, October में खुलता है। ENT करते हैं ना क्या सर class, what is rhino lake? What is rhino lake? Rhino is nose, lake is stone. So is it stone in the nose? The answer is no. It is old, calcified, foreign body in nose. Old, calcified, foreign body in nose. Now, because of the calcium, it begins to look like stone. So it's not stone, it looks like stone because of calcium. So it's called rhino lake. And how does nasal foreign body in nose only present? It is always unilateral. This is very important. Always unilateral. Foul smell from the nose, plus minus bleed. Plus minus bleeding. So unilateral foul smell plus minus bleeding from the nose is the most common presentation of rhino lake. And it's very, again, it's a clinical diagnosis, and all you have to do is to remove the foreign body. Rhinophyma. What is rhinophyma? This is a diagram of rhinophyma. So this is due to hypertrophy of sebaceous gland of the nasal skin. This hypertrophy of the sebaceous gland of nasal skin, rhinophyma. So if you look at the second image, the nose begins to be very big and ugly. This way it is also called potato nose. This is MCQ. What is potato nose? This is the name for rhinophyma. What I like about you guys are you are always very happy. हंसते रहते हो क्लास में। देखो वो दो लड़कियां कितनी खुश है, च्युइंगम भी चबा रही है साथ में। च्युइंगम, जब मैं किसी को च्युइंगम चबाते देखता हूँ क्लास में, मेरे को गाय याद आती है। बफलो देखा, बफलो वैसा लगता है। I hate chewing actually. मेरे को बड़ा गंदा लगता है। I don't know लोग chewing को क्यों चबाते हैं। समझ में? तुम बताओ, तुम तो चबा रहे थे सुबह से। देखता सब है। I know everything, but I don't say. सब कोई any faculty will know कि क्या चल रहा है सामने। Treatment. We have to remove the skin and replace a different skin. So it's called shaving of the nasal and grafting. new skin. Now, new skin doesn't mean you buy skin. New मतलब new for this area. The body किसी और इलाके से आएगा, and so somebody thought new से कहाँ मिलता है, ये कहाँ खरीदें, मिलता नहीं. You have to draw basically from different part of the body. This is a cosmetic surgery for cosmetic problem, basically. So these two are less important. The next one, very, very important. One of them is rhinoscleroma. Sclerosis in the nose. If you look at the image, you can see this is sclerosed tissue. This is sclerosed tissue. It's called by a bacteria. It's a bacterial disease called Klebsiella rhinoscleromatis, which is also called the fish bacilli. This is a micro, but this is an MCQ. They ask you alternate name, पूछते कई बार bacteria के. Fish bacilli is rhinoscleroma, Klebsiella rhinoscleromatis. इसका भी नाम है. What is this? This is called. This is called woody nose. Either woody nose or even zebra nose. So these names, we tend to get confused. What is potato nose? What is woody nose? What is zebra nose? This thing. A bunch of grapes. याद है bunch of grapes क्या था? Bunch of grapes क्या था? Bunch of grapes. Ethmoidal polyps is also called because they are multiple in number, so bunch of grapes. So these are the names they ask in the exam. Now, the most important question from here is the histopathology finding, which shows you two types of cells. One is described as the Mikulicz cell, and the other is called Russell body. And the combination is confirmatory for rhinoscleroma. If you see both these cells in a biopsy or histopathology, it's a confirmed rhinoscleroma. Plus, you have to do CT scan also, because you want to see the extension of the disease. कहाँ तक ये फैला हुआ. Treatment. You have to give streptomycin. This is drug of choice. Again, this is MCQ. Drug of choice is MCQ here, plus cautery HC. Laser भी कर सकते हैं, but nose में laser कम करते हैं. So if you write laser plus or laser, it's okay. But cautery is preferred over laser. So I'll only mention cautery, but you can mention if you want to. The laser is an option. Laser surgery. In nose we don't prefer to use laser. Cautery is preferred. And the fourth one in this series, the fourth disease in the series is rhinoscoliosis. And this is caused by Rhinosporidium seederi. Again MCQ, the pathogen Rhinosporidium seederi. And this grows in water bodies, collected water bodies. So this is in coastal areas. Coastal areas, that is seen in where the water collects. And so this is seen in people like fishermen, the Barbara fishermen. And there are four sites. One is nose, eye can be involved, mouth can be involved, and genitalia can be involved. So these are the four areas of the body which can be involved in this disease. Nose and mouth are ENT, and it is also in eye and in genitalia. So if the patient comes with rhinoscoliosis, it can have multiple sites. It's possible. But look at the color. Look at the color. It's deep red in color, and the white dots on it. And this looks like what? Strawberry. So this is called strawberry polyp. Now this is another very important MCQ. What is strawberry of the nose? Also called strawberry of the nose is rhinoscoliosis. So strawberry polyp. So Like I told you names, bunch of grapes, strawberry polish, woody nose, zebra nose, potato nose. So to remember so many names, it is not easy. So you tend to get confused. So बहुत commonly आते हैं सारे names. And treatment. Drug of choice, Dapsone. Dapsone वैसे किसमें करते हैं? Leprosy में करते हैं. इसमें भी करते हैं. Plus वही cautery excision. So these four diseases, you should talk of them together so that you don't get confused. Rhinophyt, rhinophyma, rhinosclerosis, rhinosporidiosis. And this will complete all the infection-related disease of the nose. This is the main thing. Take small disease like what is myiasis. You know what is myiasis? Maggots ko bol. What is maggots? It's a larva of a fly called either chrysomia. अगर नहीं दिया तो house fly चलेगा. If chrysomia is given, it is better. If it is not given, house fly is accepted. But if they ask you the question, they ask you the treatment. There are two options we have. Chloroform is a better option. Turpentine oil is a alternate option. Turpentine. Chloroform is a better answer. Turpentine oil is an alternative option. Right? So this is the main thing in the nose, the infections and related disease and polyp and all that. So we have done the main thing in the nose. But few other points like few things about the fractures. Fractures. Maggots myiasis. Larva of Chrysomia as a Mahira. That's how you remember. Chrysomia. सुना नहीं ये गाना? Chrysomia के संग आजा Mahira. नहीं सुना? हाँ? ये मेरे जमाने का गाना. Okay, fractures. Most common facial bone to fracture. जितनी देर चाय पी गया ऐसे ना उतना रहेगा. चाय पी ना उतना एक्स्ट्रा रहेगा. मैंने क्या बोला चाय पी गया तो कितनी बजे छूटेगी? 6:45. कितने बजे? 6:35. तब लगा लो अभी साहब. Which is the most common facial bone to fracture? Nasal bone. Sunan, you should not poke your nose in others' business. अपनी नाक नहीं लगानी चाहिए. टूटती बहुत जल्दी है. But when nasal bone gets fractured, septum fracture is also pretty common. एक ही तरफ है ना nose and septum. Now septal fracture is what they ask you because septal fractures are two types. One is called serrate fracture and the other is called jar fracture. And the difference is this is vertical fracture, this is horizontal fracture. Direction is different, the name is different. Vertical होगा septum पे तो serrate, horizontal होगा तो jar. So that's very simple. Zarzal, Jare, Jabe. Okay, what are the fractures of maxilla called? Fracture of maxilla are called Lee-Ford fracture. This is very important. What are Lee-Ford fractures? Lee-Ford fractures are fracture of maxilla. And the three, Lee-Ford 1, Lee-Ford 2, Lee-Ford 3. and they ask you the other names for leaf foot 1, leaf foot 2, leaf foot 3. Leaf foot 1 is also called longitudinal fracture. This is called, ये आता pyramidal, बहुत common है. What is leaf foot 2 also called? Is a very important MCQ, pyramidal fracture. And leaf foot 3 is called craniofacial disjunction. What is the main problem? Malocclusion. What is malocclusion? What is malocclusion? क्या? Malocclusion is ऊपर और नीचे वाले दांत आपस में फिट नहीं होते, आगे पीछे हो जाते हैं. That's called malocclusion. So normally your upper teeth and lower tooth must fit into each other when you close them out. इसमें क्योंकि maxilla is upper teeth. याद है maxilla का floor क्या होता है? Alveolus. Maxilla का floor is alveolus. याद है alveolus में दांत होते हैं, तो दांत नहीं जाते हैं, तो फिट नहीं होते. That's called malocclusion. So that's the main problem in this question. So these are the two important factors from the ENT point of view. The three leaf folds are very, very important names. And finally in the nose, tumor. दो tumor. एक आपको याद है ये वाला? याद है? कहाँ पे होता है ये? This is a tumor of olfactory epithelium. याद है? The most important tumor of the nose that they ask you is not this. कौन सी वाली? ये वाली? ये कर चुके हैं इसके पहले. ये हो चुका है. याद नहीं होगा, मुझे रिवाइज करके तो याद आएगा. This is the most important tumor of the nose that they ask you. There are three questions only about inverted papilloma. Only 3 points. One is the other name. There is one more name. It's called Ringer's tumor. And this name is a very important name. Ringer's tumor, the other name for inverted papilloma, is a very, very important MCQ. Why is this tumor important? Because it's a benign tumor of nose. With malignant potential, which means it can convert into malignancy. All this benign tumor, it can convert into malignancy. This is an important point here. That's why this tumor is so important to us. So if you're not careful, it will become malignant and then it starts getting problem. It is seen in males more than 50 years of age, and epistaxis is the most common complaint. Treatment is important. Treatment is an MCQ. So what do? Excision with wide margin. ट्यूमर को निकाल के आसपास के टिश्यू निकाल, wide margin. Why do you think we take a wide margin? We don't want to take chance. कोई टिश्यू बचना नहीं चाहिए. छूट गया तो क्या होगा? Malignant हो जाएगा. So we don't want to take chance. But this surgery is also called, the other name is medial maxillectomy. Whether you say excision with wide margin or you say medial maxillectomy, they are same thing. So these are the 2 or 3 points of inverted papilloma. And then we talk about sino-nasal carcinoma. carcinoma of nose and sinuses. Most common site is maxilla. And in maxilla, you have squamous cell carcinoma. Second most common site, ethmoid. But ethmoid में दूसरे वाला होता है कौन सा? Adenocarcinoma. So different sinus, different type. Now there is a very important point that adenocarcinoma is seen in woodworker. This is a very important MCQ. Which are the following tumor is common in woodworkers? Adenocarcinoma, the ethmoid is very common in woodworkers. A very, very important point. And all the tumors, they cause epistaxis. Epistaxis is the main presentation in all tumors, benign or malignant of the nose and the sinuses. Now comes the most important name that they ask you in this tumor, a line called on-grains line. ये बहुत important नाम, ये question आया हुआ है recently. It is used for maxillary carcinoma. How do you draw this line? This line goes from medial canthus of the eye to angle of mandible. If you draw a line from the medial canthus of the eye to the angle of the mandible, that line is called on-grains line. It is used for carcinoma of maxilla. This is that line. You can make out it is from the medial canthus of the eye to the angle of mandible. Maxilla. This is your maxilla. See, if you draw an on-grains line, maxilla के through pass हो रहा है. So it divides the maxilla into two parts. This upper part of the maxilla is called suprastructure, and this lower part is called infrastructure. Basically, on-grains line will divide the maxilla into suprastructure and infrastructure. And how does it help? Suprastructure carcinoma will have poor prognosis, and infrastructure carcinoma will have good prognosis. Okay. So if I ask you how does this on-grains line help in maxillary carcinoma, you say to know the prognosis, good, happy, bad prognosis will tell you. But treatment is same for all maxillary carcinoma, which is surgery followed by radiotherapy. So most of the maxillary carcinoma, you have to do surgery and you give radiotherapy also. Surgery followed by radiotherapy. So this is what you have to know about sinonasal carcinoma. That time one. 47.